my sticky. I'm just going to sit on the end so that you guys can cue me. Okay. Good morning. Do that one more time. I like that. Good morning. Happy Friday. Welcome. We're very happy to have a full audience today, although half of them are still in the lobby and trying to get through security, but we're going to start. Your time is valuable, our time is valuable, and we have a packed agenda of good stuff for you today. My name is Carol Seville. I'm the director of the Division of Support Contracts, and I'll be your hostess with the mostess all day today. Just as a quick heads up, if you see anybody with a yellow on their badge, that's a CMS person from Office of Acquisition and Grants Management. I'll try not to talk in acronyms. Find us if you have any questions. We'll facilitate the day for you. Couple pieces of housekeeping information before we get started, and hopefully I won't be too technologically challenged. Oh, I did it. It takes so little to make me happy. The agenda is in your packets. Everything is available online for you. I hate to read slides to people. You got this far. I'm very sure you're capable of reading an agenda, but as you can see, it is a full day, and there's a multitude of places where you can be networking and just meeting with people along the way. So please take advantage of all those opportunities. The only thing that we will ask you is to please stay in the areas that are reserved for us. We don't need folks wandering around without badges because happily our security is top-notch here, and that saves you and us, so stay where you're supposed to stay. Oh, look, I already covered that. I am so ahead of the game. The cafeteria is on the lower level. They are prepared for a mass lunchtime crowd, and it's good stuff, so enjoy that. There's a coffee bar downstairs midway through the day. Help yourself to that. And restrooms are out in the lobby area. The afternoon sessions, the one-on-one networking sessions, if you don't know if you have a one-on-one session, you don't. They were pre-scheduled. We're going to get a million of those questions. You know who you are. They were pre-scheduled meetings based upon registration, size, status of the organizations, and skill mixes that match with our particular program shops. But that doesn't mean you don't have opportunities to meet with CMS contracting officers and to meet with large businesses that are housed in the lobby to talk about subcontracting opportunities. Always a good way to get your foot in the door. And afterwards, we're going to send you a survey electronically, and you're going to tell us what a spectacular day it was, because it will be, and then provide us with any information about ways that we can improve it for the future. We do look at the surveys. We've done today's agenda based on last year's information, so we do take them seriously. Okay. Oh, yes, and one more tidbit. We are YouTubing this. I'm live. I was really hoping to be tall and blonde on the screen, but this is as good as it's going to get. And we have had the wonderful opportunity to also be able to live stream our NCMA session this afternoon. So if you had anybody that was looking at this from your home offices, that stream will also be available. It will be down during the lunchtime hour. Don't panic, it will be coming back up for the NCMA session. Okay. Did I cover everything? Oh, and I didn't cover, did we not give you great weather for November to come in? Other than traffic, you had no snow, you had no rain. For women, that's a good thing with our hair. We try, we really do try. We're very pleased today to have our first speaker, Karen Jackson, the Deputy COO, Chief Operating Officer. I promised you I would not use acronyms. Now I need to take my glasses off to see what I wrote. The biography is in your brochures, and you're welcome to read it at your convenience, but Karen oversees all aspects of our agency and our mission. That's covering Medicare, Medicaid, and the Children's Health Insurance Program. She previously oversaw the Innovation Center and the Payment and Service Delivery Model programs as the Deputy Director there, and before that she was the programmatic expert in the Medicare fee-for-service operations. We're happy to have her here today, and I will turn the agenda over to her.
Thank you, Carol, and good morning to all of you. Welcome to Baltimore. So, it's a big time, an important time here at CMS. There's a lot going on, as you know, both in terms of our acquisition activity and most particularly in terms of the events over the last few months with the change of administration that is upcoming and some of the additional attention that will be paid to delivery system reform, healthcare cost containment, and that very complicated equation around cost control and quality improvement that is such a significant part of CMS's mission. And I think that as we frame the day for you today, I hope that you will keep that foremost in your mind. Our partnership with our contractors is very important to us in successful execution of our mission, and as our work gets more complex, so does your work get more complex. So it's really nice to be able to kick off a discussion with all of you that really builds on the strong working relationship that is so important to CMS's success in carrying out its mission. I have been the Deputy Chief Operating Officer here in the agency for about a year now, and have had the very good fortune of having worked through a number of CMS's programs. And one of the things that has been most significant in my learning in the agency is how important it is to have a strong working relationship with our contractor partners. I am very proud of the work that I have done with the Medicare Claims Administration contractors in developing a program and a set of contracts there that are performance-based and for which the agency has taken accountability in terms of being transparent on performance and working in partnership with the claims administration contractors in operating CMS's Medicare fee-for-service program. That really defines CMS's relationship with contractors generally because of our historic relationship with health insurers. That is part of the heart and soul of our DNA. And I would posit that that really has defined the way in which we work with the contractor community throughout the history of our agency's existence and our program's existence. So I think that's a really nice way to frame the day and also to frame the going forward relationship with you as our partners as our programs continue to get more complex. Before I launch into what I think my part is, which is to do a very quick overview of what I love to talk about, which is the history of our programs and our agency's responsibilities, I want to do a couple of things. One is I want to thank the Office of Acquisitions and Grants Management for putting this program together. This is the second or third year that we have done Industry Day. It is consistently well received. We get very strong accolades for doing this, both from you as our partners, but also as a benchmark by other federal agencies look to in developing and expanding and enhancing their relationship with contractors. The CMS branch of the National Contract Management Association is one of the most active outside of the DC area, and many people from the DC area look to the work that we are doing here in our branch of the National Contract Management Association as something to benchmark and to inform the work that they do in the larger federal contracting context. So that is largely a function of the work that has been done by Melissa Sterinsky, by Derek Hurd, by Dan Kane before them, and I think that we have an extraordinarily strong platform on which to move forward over the next few years. So we have a video that we want to share that sets the tone and also frames out some of the background information that I will be speaking to before I turn this over to Melissa. And I think that this is the cue for that little video to kick off. Charlie, are you on it? I'm sorry? Oh, we're not showing the video. Okay, well, scratch that. This is my show. So we'll move on to the next slide then. So what brings you here today, and what brings us as CMS employees and as civil servants to CMS every day? Well, it's the mission. I don't think that there is any federal agency across the federal government that has a more profound effect on the well-being and health of the American population than the Centers for Medicare and Medicaid Services. And it's hard to deny that as a very strong driver that brings us here every day and brings us and you as our partners forward in figuring out ways to continue to improve the way in which we administer this program. And I will say that that is a powerful mission, and it is based on a set of values that I think, irrespective of the changes that happen in our policy environment, will continue to drive us forward in carrying out our responsibilities around executing this program. So, congratulations to you for being part of one of the most important improvements in our society, in our history. It's all about the money, always. We wanted to just set context here for you in terms of what we are projecting our outlays for next year. You'll see the big blue wedge there is Medicare. That includes Medicare Parts A, B, C, and D, and the Medicaid with the expansion of the Medicaid program to expand eligibility beyond its historical bases. We're looking at a continued significant wedge there. I'm proud to say that the Innovation Center wedge is getting a little bit bigger. That 0.2% is a percent of overall benefit outlays, and it is growing as our value-based purchasing programs increase in size and scope. And as we expand on the bundled payment for care initiative, some of the other activities that have been underway over the last 6 years since the Affordable Care Act was passed, linking quality to payment. I think what you'll see if we looked over the next 10 years, that while the Medicare wedge continues to grow as an overall percentage of the agency's total budget responsibilities, much more of that wedge is going to be associated with value-based payments. And that's certainly consistent with what is happening more broadly across the health insurance market. The other thing that I would say to you about this, and just moving on to the next slide, this is a little bit misleading in terms of the title of the slide with respect to outlays. This is overall control of the federal budget. You can see that CMS's programs were just under $1 trillion. We have inched above the Social Security and disability benefit programs. We also exceed defense outlays and benefit payments that are administered out of the direct sources funded through the Department of Treasury. I would say about this a couple of things. It becomes, because of the significant footprint that we have with respect to benefit payments, it becomes even more important for us as a partnering community to think about the ways in which we are able to assure that the programs that we are administering, that we are executing through you, are targeted toward assuring the highest possible quality and managing the cost of those programs in such a way that doesn't continue to impede us from being able to do other things in terms of our programs across the federal government and state governments. Being efficient in how we administer those funds, that falls into CMS's mission, and by extension, it falls to you in terms of your responsibilities as well. So I hope that as you walk out of this meeting today and in your conversations with my colleagues here at CMS, as you think about how you are going to be approaching the work that you do with us, it is with this footprint in mind. This is keeping us as a society from being able to do other things that are equally important, and making sure that we manage this as good stewards in everything that we do, in our working relationships, in the way in which you are running your businesses as federal contractors, in the way that we are writing requirements for you to execute on. This is the most important thing, and what I would say to you, the most important piece of information that you should leave with today. So here's a little bit of the history. I talked a little about my career arc here, starting with the Medicare Fee-for-Service program and the converting of our underlying core business model from fiscal intermediary carrier contracts over to the Medicare Claims Administration contractors, the MACs. And I would posit again that that has really defined the way in which we approach and are structured here at CMS in terms of doing our work. There are other programs that have really driven where we are today, and I think will continue to influence the way in which we build our work and build our relationships with you in the future. And you can look at this in terms of the way in which Medicare and Medicaid have created their reimbursement relationships with the provider community over the last 25 years. The first big piece of legislation, obviously, 1965, the original passage of the Medicare program, Medicaid programs. But quickly after that, as enrollment increased in both of those programs, it became very evident from a public policy perspective that we needed to figure out some ways to manage payment. And that led to some payment models, some very early demonstration programs in the early 80s that established our diagnosis-related groups program, the DRGs and the structure of payment that really signaled the way in which Medicare and other insurers would be paying for services even up to this day. 1997, the Balanced Budget Act, Balanced Budget Act and the establishment of the Children's Health Insurance, which was an expansion of the Medicaid program, but also led to the building of many of the prospective payment systems, inpatient prospective payment, outpatient prospective payment, home health, skilled nursing facility prospective payment. All of these are now woven into the fabric of CMS's programs and, again, have influenced, I would say, every piece of the work that we do across the agency: Medicare, Medicaid, CHIP, health insurance marketplace, because that is the underlying framework of the way in which healthcare services are reimbursed. So the next expansion of the Medicare program came in 2003 with the Medicare Modernization Act and the establishment of a prescription drug benefit. And I suspect that some of you in this room began your business relationship with CMS about that time, because CMS grew significantly both in terms of its scope of responsibilities and also in terms of the volume of contract activity that we undertook. That was what brought us to the shifting over into many of the performance-based contracts that are part of the agency's scope of responsibility now. And I would say, until about 6 years ago, it seemed like it was the hardest piece of legislation that CMS would ever encounter, ever again, until 2010, when everything changed again. The Affordable Care Act, golly, it has really provided the framework for the next generation and for the future of the Medicare and Medicaid programs, notwithstanding or in addition to the expansion of health insurance coverage to another 20 million, maybe this year, another 25 million Americans, and really cutting into the number of people who are without insurance. The Affordable Care Act gave us an opportunity here at CMS to really start looking at how we optimize and synthesize aspects of the Medicaid and Medicare programs through our Innovation Center authorities, through some of the mandates that came along with that. It also gave us an opportunity to look at disparities in healthcare coverage and healthcare services across the country, and use some of our authorities to address those disparities. And the outcome and result of the implementation so far of the Affordable Care Act has been an expansion of coverage, an increase in access to care, and an improvement in care outcomes for our populations who are receiving services through our program. And I think that that is an incredibly important way to move into other aspects of the legislation that we're implementing now, the Medicare Access and CHIP Reauthorization Act of 2015. One piece of that some of you are already involved in includes the removal of the Social Security number from Medicare cards, other external-facing Medicare identification. The other aspect of MACRA, in addition to many other provisions that people are working very hard to implement, though, is a bridge further. And I would say not a bridge too far, but a bridge further that allows us to move further into linking quality to payment. And the quality payment program is that. It really allows us, again, to look at our legacy programs, look at how to make that linkage of what is happening between the physician and the beneficiary, and making sure that that relationship and the value and strength of that relationship is recognized in reimbursement. And by the time we talk again, maybe not next year, and maybe not in the next year after that, but certainly by 2019 and 2020, we will be talking once again about significant improvements in care outcomes for our beneficiaries at the same time that we are seeing a significant increase in the number of beneficiaries who are part of the Medicare program. And that benefit will extend over to the Medicaid program as well. MACRA was a bipartisan bill. It had support from both the Republican and the Democrat side of the House and Senate. We do not expect that to change significantly, at least right now we don't expect that to change significantly. We are moving forward full force, full steam on implementing that piece of legislation and continuing to build out the improvements in the Medicare program and the Medicaid program so that the programs are available to Medicare beneficiaries in the future. And we are able to look at that arc of cost growth that you saw in these earlier slides and see that not be such a significant part of overall federal outlays so that there are resources available for some of the other investments that are so needed in our country. That's why we're here today. And that's the challenge that I hope that you will take with you when you go back and talk to your staffs. So what's on our plate right now? Well, we're waiting to hear who our agency review team will be. We are ready for the transition. We will be continuing to do a lot of preparation work, both to execute on the priorities of this administration and also to be prepared and to prepare ourselves for the priorities of the next administration. And it is a pleasure to be doing that with you because you are our partners, you know our work, you're committed to continuing to work with us to improve our Medicare, Medicaid, Children's Health Insurance Program, health insurance marketplace, and we can't do this without you. So I hope that you take advantage of the day, talk to my colleagues, talk to each other about what we can partner on to continue to build our programs and to continue to strengthen our programs for us as beneficiaries, for our family members as beneficiaries, for our children. I wish you a really good day today, and I look forward to speaking with you. And I will turn this over to Melissa. Am I turning it over to you or back over to you? Okay, so Carol is the master of ceremonies here. Listen to her. Thank you all very much.
Thank you, Karen. Karen gave us the overview, and if we were a nonprofit, that would be our mission statement on the top of the letterhead that sits at our desks every day. This is why we're here. Melissa's going to make sense of it from the perspective of what do we do every day as we arrive, and how do we continue to work with the new vendor community, of which some of you will hopefully become our new vendors, to continue that mission-oriented goal and to move us forward. We're very happy to have Melissa back as now the head of our contracting activity and the director of the Office of Acquisition and Grants Management. She brings an interesting flavor to our office because Melissa brings a strategic vision that takes the day-to-day procurement and grant work and reminds us of how we need to keep moving forward as an acquisition community, the big A, not the little p procurement, and hopefully you are already or will become a part of that big acquisition team and work with us to increase our business relationship and to help us become transparent with you in terms of how we work to achieve our mission and where you fit in. So with that, I turn it over to Melissa.
Thank you, Carol, and welcome to everybody. It's so great to see such a full room of folks, and I'm really looking forward to the day. I think it's going to be a great day of learning for all of us. We've got a number of our staff here that will be spending the day with you, and I'm particularly interested in hearing the Reverse Industry Day, because I think you have a lot of perspective and insight that we want to harness to better understand how we can improve the service delivery internally within CMS and also partner with all of you. As Karen said, we cannot do this work alone without you. And we rely significantly and heavily on our contractor partners to carry out this very, very important work. And so we really look forward to continuing that relationship. We've often said the work is as much about the relationship as it is the work itself. And so very important. We want to make sure that you feel that you have the right access to us, that we're transparent in the work that we do, while at the same time maintaining the integrity of the acquisition system. I will tell you, I think in your program there is a typo in my email. So if the number 1 should be at the end of my last name. And so if you want to pen and ink that change, and we'll make sure the electronic version that's posted on our website includes the correct email address. I am always accessible and available, and so please make sure to reach out to me or Derek if there's anything that we can do to help you do business with us at CMS. So who we are. As Karen said, we're here to support the agency in the execution of the programs that we have here. We are comprised of a staff of slightly over 200 folks, and we have 5 groups within the office that carry out all of this work across the agency. And you see here, last year we did just over $9 billion when you add up all of the contracts, grants, and interagency agreements. And here's just a graphical depiction going back from 2006 to last year that illustrates the growth that we've had in the contracts, grants, and interagency agreements. And obviously we saw a pretty big spike there in 2014, dropped a little bit in 2015, and it went back up a little bit in 2016. So we've continued to see steady growth over the years. And as Karen said, we're actively engaged in transition activities, and we'll have a better sense of what FY17 is going to look like. But we're prepared to execute. We've talked with our staff. I believe contracts are contracts regardless of the policy decisions. And so we stand ready to support the agency in whatever policy decisions that are made moving forward. Wanted to talk about the importance of our small business partners, and again, thrilled to have the small business community represented here today. How many of you are new to CMS or trying to get into CMS? Great, fantastic. So we hope you'll find today a great opportunity to network with some of our current large business partners and staff in OAGM. We really want to learn about your capabilities and how you might fit in to the requirements that we have here in CMS. We strongly support the small business programs and believe that small business is really the economic engine of our country, brings a lot of innovation and competition to the marketplace, but we also need our large business partners as well, and we think we need to have the right balance of all of those industries represented in carrying out our work. So last year, we've been very successful in meeting our small business goals, in part to all of you. Our goal last year was, overall small business goal was about 16%, and we eked out at the end of the fiscal year just over 16%. That added up to about $1.2 billion of our overall spend. And so again, we could not have done that without all of you. We also did achieve some of our socioeconomic goals. Small disadvantaged business, our goal was 5%. We ended up with an overall goal of 9.48%. Women-owned small business, we exceeded our 5% goal with a total of 7.76. We continue to have some challenges in the hub zone and service-disabled, veteran-owned small business categories, and so we really are going to continue to make concerted efforts to try to reach out to those socioeconomic categories to try to bring some of those numbers up. So pivoting to the strategic plan, Carol talked about really bringing kind of that strategic perspective. I think and Dan, I see Dan in the audience back there. I had the opportunity to be here a number of years ago as Dan's deputy, and we really embarked down a path of really thinking strategically about what are the things that we can do to move the organization forward, to move our readiness forward. And I'm pleased to, I've just been back to CMS now since June of this year, and I was thrilled to see the work that's been done on the strategic plan to move our readiness forward. And Karen talked about that. I think there's been great growth over the last 5 years or so in terms of our accessibility to you. Hope that's the case. I think through some of the affiliations that we have with organizations like NCMA, it's created a forum where we can have some good conversations about the acquisition system and what we can do together to move that readiness forward. And so we're in the midst now of a strategic plan refresh. And so if you go to our website, you will actually, there's a link to our strategic plan. As part of our outreach efforts with industry, we are asking you to take a look at that if you've not already done that. And if you have any feedback for us, we ask that there's a mailbox that you can send that feedback to. We're asking for any feedback by December 2nd. And our goal is to try to continue working with internal, external stakeholders, continue to flesh that strategic plan refresh out a little bit more, and try to publish something in early next calendar year. But I did want to share with you a couple of themes that are emerging as we conduct our stakeholder outreach and talk internally with our staff and with our management team in OAGM that are likely to rise to the top of some of the initiatives that are going to be areas of focus for FY17 and beyond. So I just want to spend a couple of minutes talking about those things. And there are about 7 of them. So the first one is to continue to refine how we are conducting debriefings. The spirit and intent of debriefings is really to give you all feedback when you are unsuccessful in winning a contract award. And we want to make sure that the information that we're giving you is valuable, because our goal is we want to make sure that it helps you improve the proposals and the solutions that you're bringing to the table. And so we have an effort underway right now where we're really doing an analysis to understand how are we handling debriefings across the office and what potential changes might we want to undertake to strengthen how we give you that feedback. The second area, and there's kind of two that kind of go hand in hand with this, and Karen alluded to a little bit of this in her talk, but there's an effort underway across the agency right now about lean, really looking at internal processes and trying to identify opportunities where we can strip out waste, unnecessary process. And so one of our strategic goals that you'll see if you look at our plan is around policies and processes. And I think there's some language in there to the effect of if it's not required by law or regulation, it's not adding value, or we're not doing it as a result of a self-identified vulnerability or a risk, then maybe we shouldn't be doing it. And so we're going to really be looking at our internal processes to really assess, do they make sense? What's the right balance of that? And so related to that is continuous improvement. So trying to identify opportunities where we can improve how we conduct our day-to-day business. The third one, and again, some of these are all really intertwined, is trying to give all of our stakeholders a consistent experience. And sometimes that can be challenging because the Federal Acquisition Regulation, gives the CO, contracting officer, a lot of latitude and authority in exercising that business judgment. But again, as part of our efforts, really looking at process, looking at how we're conducting our operations across the office, is there some opportunity to try to drive some standardization and consistency while at the same time allowing enough flexibility to respond to the unique circumstances that might be before us. The next one, of course, agile contracting, agile technology, methodologies. We've really had a strong USDS presence here over the last couple of years. And I think if you've been following QPP and the portal that we launched on October 14th, I think the work that we've seen there is the direct result of our maturity as an agency, your maturity as business partners, bringing in some potential new partners to help us with this work. And so that will likely continue to be a priority of ours when it makes sense to really look to those methodologies to do the work that we have before us. The next one is acquisition strategy alignment. And so as I came back, it's a lot of puzzle pieces to try to fit together and understand how they all fit together. And so I wanted to look at our acquisition strategies that we have in place. And so we have about 48 major IT investments in CMS, and those investments support about 12 major program areas. And so the 48 IT acquisition strategies are already developed, but we are beginning our journey in developing the acquisition strategies for those major program areas. And I'm really excited about that. And I think we're taking a slightly different approach to how we've done our business, acquisition planning, acquisition strategy than we have in the past. And it's really about identifying the right stakeholders that have a stake, in those strategies, getting folks together, including small business representation, getting the department representation, getting Office of Technology Solutions, Office of Enterprise Information, our contracting staff, getting the right people together to really understand and talk through what is it that we're really trying to achieve with these strategies, what outcomes are we really looking to achieve, how do all of these pieces fit together, what systems need to be coming down by when, which systems need to be coming up by when, and trying to figure out and put all of those puzzle pieces together. And my hope is that we'll have greater clarity, greater alignment, longer acquisition lead time, so that we can give you more time to respond, so that we can give you more time to pursue the partnerships that might be necessary to support that work. And so we're just beginning that journey. Our hope is to have all of these acquisition strategy documents complete within the year. And I hope that you're going to see some benefits as the result of that work. The next thing is, the value chain, the value proposition of what we can offer out of OAGM. And, really defining what are the true north metrics that help us understand the service that we're providing to the agency, that we're providing to you. And we're working to really try to define that. Is it speed, is it quality? It's probably all of those things. And figuring out what's the right balance of all of that. And how do we define metrics that can help inform adjustments we need to make and how we can improve. And then finally, data management, data, and having visibility into that $9 billion of spend to make sure that it's optimized, to make sure that we're resourcing the work in the right way. And right now, so we have HighGlass, which is our accounting system for the agency, and in OAGM we have what's called the Comprehensive Acquisition Management System, or CAMS, and those two systems don't talk. And so there's a lot of manual reconciliation and an inability in some ways to really have that visibility into our business and how we're spending all of that money. And so the Data Act is actually going to be a catalyst to accelerate our efforts to integrate HighGlass and CAMS, and that's going to give us greater visibility into the data so that we can be smarter about how we go about doing our work. So again, those are kind of the 7 things that are kind of emerging, but we want to make sure that we hear from you, hear from all of our stakeholders. And every year we'll undertake a review around what are the things that we should do every year to try to help us realize that long-term vision that's going to give us the greatest bang for our buck. And so more to come on that, but please, if you have not already had a chance to look at that, please do so. One thing, too, I did want to mention, when Karen talked about, it's all about the money, I would encourage you, if you have not already done so, to really dig into our budget submissions and the budgets when they are passed, because that can be really, really important and helpful for you to understand the agency's priorities. And it's a big document. How many of you have read it? Yeah, it's a big document, but I think it's well worth your time to understand where those dollars are, what programs they're supporting, because it can help you narrow your focus in what opportunities you may want to go after. So I talked a little bit about this already. So yeah, by December 2nd. So our FY17 acquisition forecast, so I'm pleased to report that that is up on our website. And I think there's about 130 opportunities currently that are listed on that forecast. Derek and I have actually started our stakeholder engagement meetings with all of the box tops across the agency to continue adding to this list. And again, I think the work that we're doing with that acquisition strategy alignment, our goal is to find out about these things way earlier than we traditionally do, so that we have the time, that you have the time to put together really good, innovative, cost-effective solutions. So we'll continue to refine this, continue to work this, but if you haven't had an opportunity yet to look at the opportunities or the forecasts that we know of right now, you can go to this link and find those. And this is the kind of information that you would see there: the number, the anticipated solicitation release date, the current incumbent, and you see all of the things that are listed here. How many of you have had a chance to look at it so far? Wow, good. Pardon me?
Thanks for the spreadsheet.
Sure, sure, it's a spreadsheet. So again, we'll continue to refine that. Again, you know, as I said, as Karen said, we cannot do this without you, and we want to be transparent, and we want to share with you the requirements that we have. And then finally, we are one big A acquisition team. The Federal Acquisition Regulation actually defines the contractor as a member of the acquisition team. And so we value the partnership. We need to work together to get this work done. We have to maintain the integrity of the acquisition system. We want to be as transparent and accessible as we can be. And if we do that, I think it results in a much more effective, efficient acquisition system. And then finally, I did want to spend a moment to thank the Industry Day Planning Committee. It takes an awful lot of work to put an event like this on. And so, you know, to all of the speakers, presenters, and panel participants, networking participants, volunteers, a big, big thank you. Carol Saville, Brian Hebel, others on our OAGM staff have done a magnificent job in pulling all the details together for today's event. Other folks include Andy Mummert, Mark Werder, Teresa Schultz, Ed Hughes, Carol Seville, Brian Dan Levinson, Sabrina Thompson, Janet Alfonso, and Abby Smith. Teresa Lewis, who we're about to introduce to you momentarily. Teresa Schultz will be moderating our small business panel this afternoon, so thank you, Teresa, for that. Our afternoon speakers, Mark Werder, Beth Citaroni, Chris Hadjipanos, and NCMA, thank you to all of you. I think the events in the afternoon around the cost accounting, is that this afternoon or this morning? This afternoon. Really important. We do a lot of cost reimbursement contracting, and you have to have an approved accounting system to be able to be eligible for cost type contracts. So I think there will be some really good information for you to hear this afternoon. Our networking partners, and again, everyone, thank you all so much for being here. Look forward to a really productive day of learning for all of us, and hope that as you leave here today, you have found the day to be worthwhile for you. So with that, thank you. Have a great day, and we'll look forward to continuing to work with all of you.
Before I introduce the next speaker, I do want to just take one moment. You've heard the name mentioned. Our deputy director is Derek Hurd. If you see him, I'd like him just to stand up for a minute so you can. It takes two of them in the front office to herd the rest of us in. So now you know our mission from Karen. You know how we operate from Melissa. Here's the person in the Cape. This is your Cape Crusader. She is the biggest advocate for you. There are approximately 6,300 FTEs at the agency and about 95,000 contractor employees. You want to increase that number. Teresa Lewis is going to talk to you about where you fit in and how she can assist you and facilitate small businesses, hub zones, disadvantaged, women-owned businesses, so you can get your foot in the door and help us with our mission. So I'm not going to take a whole lot of time. I want to give her the time to speak to you. Teresa Lewis, the Director of the Office of Small Disadvantaged Business Utilization.
Carol, let me just say how marvelous you are, and I want to talk to you about an MC job. So, the break is in 5 minutes, so that means I got to talk fast. All right. So, let me just thank CMS again for the invitation. It's always an honor for me to come. It is just always a pleasure. We award at the department level in direct contracts approximately $25.5 billion annually. CMS, as part of the HHS family, awards approximately 1/3 of those dollars. So they are one of the biggest lions in the den. And so for them to put on an event such as this today, it's a wonderful thing, because there are some agencies who say they want to do business with small business. This is one of the agencies that actually puts their money where their mouth is. So to CMS, I just want to say kudos to you, Melissa, for all the work that you and your team are doing. To Derek, I just want to say thank you always for thinking of Ostibu. I want to thank Andy for reaching out to me, bugging me, nagging me to make sure I got my presentation in. So I just want to thank you for that. But I want to say also the conference team. The conference team, aren't they wonderful? Guys, just give them a quick hand. The facilitation of bringing us in, so I just have to tell you a quick story. Those of you who know me, you know I love to laugh, right? So I'm going through the badging process. Those of you who are currently government contractors know what I'm talking about. So I put my paperwork in about a month before it was due to expire. They're still working on it. So I got here today. In fact, I started to go to Panera and say, Derek, come get me. Got here today. I've never had to go through this. I had to pop my trunk, pop my hood. I said, I don't know where the hood popper is. So security was walking me through that. So anyway, I'm just happy to be here. I told Derek I don't typically get here on time. Actually, I got here early today because I knew something like that was going to happen. And so the conference team just took great care of me when I came in today. And so I just want to say thank you. And thank you to OAGM for just being a wonderful team. I have a partner here. Anita, will you please stand? Anita Allen is the Ostibu Small Business Specialist that supports CMS, but she also supports all of you. SBA is in the house. SBA, can you just stand for a moment? Fantastic. The Small Business Administration is, as most of you know, statutorily responsible for implementing and overseeing the small business program throughout the federal government. They have, at least when I worked there, they had over 68 district offices. Today, not only did the Baltimore district office come out, but the Delaware district office came out, as well as the procurement center representative, and they are here to support the small businesses as well. So I just want to say thank you to SBA for being in support. And I see a lot of small business owners that I recognize. It was great to see so many new hands to stand up. So I just want to say to all of you, thank you for coming. And to the large primes, we work very closely with the large primes to ensure small businesses are involved in the procurement of HHS contracts. So it's just, it really is a big team. And I have to say, Melissa, I didn't see small business on your acquisition team, so we got to add that square to your slide. So Melissa stated they're working on, it was Melissa who stated that they're working on more time to respond to give small businesses time to respond to solicitation. That sounds like a dream. Isn't that a wonderful thing? To be able to take your time and get it right? Especially those of you who've reached out and have tried and it just wasn't successful. So I just want to say kudos to you guys for doing that. I typically, in my presentation, address the budget in brief. She did. It's just such a critical document when you're moving forward. It's that document that you need to review before you even start looking at the forecast or doing any other homework. That's the first place to start. Just to hear and see and to hear her talk about the strategic plan, their themes. When she said themes, I thought about opportunities, how great it is for you to be in the place to hear where the focus is. Because I think that, especially from a small business perspective, that's where so many of us get lost. It's where do we start? Especially when you're in a pool of a $500 billion contract pool, federal government wide. So sometimes that elephant can seem so big. And to hear a leader such as Melissa share with you what her focus is going forward, that to me is just invaluable. If you didn't get anything else out of today, what she shared with you on what the focus is for CMS, not only Melissa, but Karen as well, to me, that is the answer to the test question. You can go home now. All right, so when you see this in the news, if you can read that, it says the electronic health record, boom or boondoggle. AARP had all of these headlines. When you see those headlines in the news and you're looking for opportunities, that's where you start. Quite often, small businesses sit down with us and they'll say to Anita and other staff members that I have, what do you need? Or some will even say, I can do anything. You can't. Those slides, those just give you an example of where to start. Okay? What Melissa shared, what you see in the news when you're looking for opportunities, those are places to start. All right, so this probably should have been my first slide. I need the veterans to please stand just for a moment. CMS, if you'll indulge me. If you're a veteran of the military, will you please stand? I just want to say thank you. Thank you for your service. Happy belated Veterans Day. And if you're in the Air Force, a special salute to you. All right. So, I bring you greetings on behalf of our Secretary and our Deputy Secretary of HHS. This is our mission, because that's what it's about. It's not about what you do. While we all love small businesses, it's not about what you do. It's really about assisting us with achieving the mission. This is the mission of the Department of Health and Human Services. Melissa and Karen shared with you the mission of CMS. Understanding that, and I say to you veterans in particular, you understand what it means to achieve the mission. And I don't think anybody knows it better than you. So understanding what's important to that organization is how you make headways into that organization. So these are our priorities. HHS is statutorily responsible for over 300 programs, and here are just a few. Head Start, Medicare, Medicaid services, assuring food and drug safety, just to name a few. We have 10 operating divisions, CMS being one of them. Are there any small businesses here that are currently performing at a different HHS Optive or agency, but now you're looking to grow into CMS? Okay, so you bring a wealth of experience. Make sure when you meet today that you let the CMS counselor know. We employ over 85,000 employees, and we're the largest grant-making organization in the federal government. If you've been to grants.gov, HHS owns that. Our achievements, currently we have achieved our overall small business goals, but we still have work to do. Are there any hub zones? Quite a few. Hub zones, you guys, we have monthly vendor outreach sessions. You guys don't come. We hosted one that was just for hub zones. You guys didn't come. If you're looking to get into HHS, you need to show up and let us know that you're here. I'm happy that you're here today. We need to see you also at HHS events. We're responsible for 10 regions throughout the country, and we actually host outreach events in the various regions. What do we buy? We buy just about everything except that which supports the warfighter. We don't buy tanks, we don't buy planes, we don't buy ships, but we buy just about everything else. So there is somewhere for you to support us. Are there any contractors that once served the warfighter and are now looking to expand into civilian agencies? Okay, so for those that raise your hand, have you changed your capability statement? Some are saying yes. Some aren't responding. So let me just say, for those of you that are not responding and have not done so, you need to do that. Because what DOD bought is not what we bought. So, or what we buy. So you need to change that so that you can address our needs. Just a little suggestion. How we buy. We're talking about risk. How much risk can you absorb? Based on the type of contracts. Melissa said they spend a majority, they award a lot of cost type contracts. What does that risk look like to you and your organization? This is an eye test. Put your right hand over your left eye. So let me just share with you a few best practices. I briefly mentioned the capability statement. I think that capability statements should be alive. So what does that mean? The mission of CMS is different than the mission of NIH, the Food and Drug Administration. If you are targeting the various agencies, after you've done the work in the budget and brief, then your capability statement should address what our needs are. It should address our mission. So when you give us, if you give us just a general capability statement, there's not a whole lot we can do with that. Also, all of the gobbledygook that a lot of you all put in some of your capability statements, we don't know how to interpret that. We're such a friendly company. We hire nice people. Here's my picture on my capability statement. We don't know what to do with that. We need you to be very specific. You can use the front and the back. That's about it. Save that long PowerPoint presentation when you meet with the techies, when you meet with the program managers and the project managers, when you're meeting with those initial counselors and the gatekeepers. Keep it a clean one-page bullet statement. Even if you want to provide us with your mission, which we don't need. We don't need to know your mission. What we need to know is how you can help us. Okay? So make sure that when you give us your CAPE statement, it's quick. It's something that the contracting officer can pick up some salient features and they can use that and move on. Even your business cards, Your business cards, and I think I have a slide on it, that should be a mini CAPE statement as well. SAM, in your SAM profile, make sure that you read that profile the way that we do. Don't log in as a small business. Just go to it as the general public. Look at your SAM profile the way that we see your SAM profile. Because that's going to tell you what's missing. That you'll be able to see it as we do. And we do use SAM. We do use the SBA Dynamic Small Business Search. So I see a lot of the documents that are, a lot of the profiles that are in there, it's missing information. In SAM especially, I see where there may be your DUNS number that's in your entity description, but it's not in the financial section. If you want to get paid, unless you're just going to donate your services to the government, I strongly suggest you add your DUNS number in the financial section of your SAM profile. The budget in brief, we've talked about that. Here's an example of CMS, of an extract from CMS in the budget in brief. This is why it's just so important. So they're telling you that they've got $199 million in new investments. Who wouldn't want a piece of that? That's why the budget in brief is so critical. Understanding where they're going to put money and understanding where they're taking money away. What's a priority, what's no longer a priority. And that's what it looks like when you go to it. This is just some additional information that I pulled out. All right, so how many of you use the FPDS as a market research tool? Okay, all right, so about 1/3 of you did not. For those of you who do not, in that easy search box is where you can put the NAICS code of the industry or the work that you're doing. That's going to tell you who currently in the federal government is performing that work. Who in the federal government actually needs your services. So that's what that's going to do for you. The procurement forecast, I know CMS has an Excel spreadsheet. We also have a procurement forecast on the HHS website, which is an automated system. It's web-based, so you can do your research there. FedBizOps, yes, we do announce all of our opportunities on FedBizOps. We use GSA also, GSA Advantage. Again, if somebody tells you it's too late, it's not too late. Although I do believe that you need to start your research early. Strategic partnering, if you are looking to get involved in some of the larger procurements, my perspective is always, it's like a marriage. It's easy to get in, it's hard as hell to get out. So be careful of whom you choose to team and partner with. All right. Just some various ways to team. I think you guys are going to get the slides. Derek has given me the hook. SBA has subnet if you're looking for subcontracting opportunities. The one thing I want to say to you guys about subcontracting, our large primes are looking for the same things that we're looking for. We're looking for a partner who can do it faster, smarter, better, cheaper. And they're looking for the same thing. They're also looking to find out if you have any new opportunities that you can bring to them. All right, these are our top primes. You can find this directory on FPDS or in FPDS. These are existing contracts, again, teaming opportunities. All right. Category management, it's here to stay. Right, we used to hear a lot about strategic sourcing. It's morphing into category management. Different industries. How are we doing business in the commercial world? We're now flowing that into the federal agencies. All right, networking, your business cards, I talked about that, how important it is. And don't waste any money on the glossy cards, guys. We can't write on those. Okay, all right, and knowing the rules. Do your homework. You got to do that. Your conversation when you meet with us is a lot different when you do your homework. You can't just walk up to us and say, I'm a hub zone, I'm a service disabled veteran. You haven't met your goal and you need me. No, we don't. Okay? We need someone who can talk to us about our mission. All right. So, Derek, I got 2 minutes left. Do I have time for any questions? 2 minutes? All right. Any questions? Anita's going to be here all day. If you haven't already done so, please go to our YouTube site. We have videos on how to do business with respective agencies here at HHS. It's just HHS Ostibu when you go to YouTube. All right. All right. So thank you. Thank you, Derek.
Okay, I have to say, she has some amazing information, and Teresa rushed through the slides to try and keep us somewhat on time. Please take the time to look at them, even the little tidbit about your business card. Who'd have thunk it? But think about it. If it's glossy, we can't write on it. I mean, just really important tips. All right, we are about 15 minutes behind. Welcome to the world of the federal government. I'm going to try and keep us on par as quickly as I can, so if you can take a break. Ladies, I'm sorry, there's already going to be a line at the ladies' room. We're going to get the stage set for the small business session. It's an amazing session. We're very excited about it. So please try and come back in no later than 10 minutes so we can try and make up the missing 5. Come on back.
And then once that's done, if you guys just want to kind of spread yourselves 2 and 2 on the sides of the room. I would say just above the blue line, yeah. It does not matter what order. Any order that you want. say you want one?
Yes, thank you so much.
Hello. Hello. Having that facility?
10:19, when do I end? Where's my notes? Where's Abby? Yeah, I think it's maybe that. It is. Yeah. Is that better? Is that better? Okay.
I didn't know you were on the panel. Yes, sir. Teresa's ready to
I'm
join
going
you.
to try and just, okay.
We're going to try and get started, so if you have cohorts in the lobby, please bring them in, and we're going to start in about 4 minutes.
Mama don't mess around. I'm going to end on time. Yeah, you know what, but I think this is yeah. See, I've got a lot of questions. I don't have to ask them all, so I can. See what? Yeah. I am going to talk in the intensity session about share what we see in the score. So doesn't belong anywhere else because I have a lot of questions. I've already got some questions. They asked me to do that, and so the answer for Spark is it's moving along. It's in the middle of the procurement cycle, and when that's resolved, we'll have an answer. But at this time, we don't have an answer for you.
They had 280 people, so it's still good. Set my shows.
Are there any? Did we let walk-ins in?
We had three. We had like 3 or 4. Worked fantastic. Yeah, I agree.
You don't come, we can't help you.
Good luck. I'm going to be sitting up
Thank
here.
you.
Yeah.
If I say anything wrong, go like
You
this
won't.
to me.
You won't. You won't.
In 5.
Okay.
In 4. In 4.
I'm going to start. Let's get people from the lobby.
Okay, yeah. I'm not sure how the. Because I was going to tweet it. Okay. Okay.
Okay, we're going to get started in about 2 minutes. If you could take your seats, please.
Slowly. Oh, okay. So as long as the lights down and okay. Okay. Get started. Oh, I just said 2 minutes. Yep. And they're going to put the projector back down. Yeah.
Okay, we're going to go ahead and get started in about 1 more minute. If you could find your seats, please. Is that okay, the light? Either that or they turned the lights down.
Is it bothering your eyes? Because we can turn them very off. Yeah, okay. Well, you know what, Teresa? After you introduce them, give them, like, tell them you're going to turn that off in about 5 minutes. So can you stand it for about 5 minutes so you can write your email?
All right, if everybody could take their seats, please. We want to go ahead and get started. Okay. All right, our next segment is some small business success stories. I'm thrilled to be here today. It's very exciting to see so many new small businesses here. We thought it would be really informative to bring some of our small businesses, some still small businesses and some have graduated to large businesses. We wanted to bring them here today to talk a little bit about what they did, what their success story was. How did they start at CMS? And maybe give some really good advice to those of you who are new, and some of you may be the very first time that you've even been to CMS. So it's my pleasure to present my small business panels today. Michael Keck from Adaptive Systems, he's partner at Adaptive. Next to Mike is Sean Keon Hartz. She's the CEO and president of Provider Resources Incorporated. Peg Stessman is the CEO of Strategic Health Solutions. And Leah Heimbach is the principal of Healthcare Management Solutions. And last but not least is Mike Carrier, who's the chairman of Ventec Solutions. Their email addresses are displayed on the slide. That slide's going to only stay up for about 5 minutes because the light is really in their eyes. So we'll display it again after the segment's over. So we're going to start by having each panel member talk a little bit about their company, what their core competencies are, what their real story is. How did they get into the CMS space? What some of their challenges could be, and just like how they got here. And then we're going to have some prepared questions. And at the end of the segment, we're going to open it up for you to ask questions of them. So with that, I'm going to start with Michael Keck. So Mike, if you could introduce yourself, talk a little bit about your company, and a little bit about your story.
Good morning. Good morning. My name is Michael Keck.
Can everybody hear? Okay. Where's Abby? There we go.
A little switch on the bottom. Just switch it on to Thank you.
Good morning. My name is Michael Keck, and I'm representing Adaptive Systems. I'm one of 3 partners in the company.
A little closer.
Good morning. My name is Michael Keck, and I'm representing Adaptive Systems. I'm one of 3 partners in the company, which was established in 1999. We have been working at CMS since our inception, and over that 17-year span, we've acted as prime contractor on many efforts that have included a broad range of IT services, including full life cycle software development, program and project management, business intelligence, large-scale independent testing, and database administration. Adaptive entered into the SBA 8A program in 2004, and we enjoyed a great deal of success in the program, so much so that we graduated the program a year early, and we are now classified as a large business, and we are looking forward to facing the challenges that lie ahead, and we appreciate the opportunity to be here this morning. Thanks.
Good morning. Can you hear me? There we go. My name is Shawn Keogh-Hartz. I'm the CEO and President of Provider Resources, Inc. Our company is 13 years old. It was a company that I acquired and had been running, and I'm not telling you how many years I ran it because then it really ages me. Yeah, well, pieces that you leave out. As a company, I think we're probably best known for our clinical expertise and our medical review and policy expertise. Through the years, we've been engaged many times through CMS for a lot of evaluation or oversight type contracts. We tend to hire high-level experts, always with an educational focus. And so we've also had educational and outreach contracts since 2009 here at CMS. I think our first contract at CMS was in 2008 as the RAC validation contractor. We still hold that contract today. Thank you very much. To know that you'll have it for 10 years is an amazing feat, but I think it's a testimony to the quality of the services that we attempt to provide for the agency and the level of the people. We were 8A. I'd say that 24% of all of our revenue has come from sole source contract awards. We graduated from the 8A program in March of 2016, and there's a lot of challenges with that. In order to be able to continue to sustain, and I think every company looks at sustainability. Mike just mentioned about graduating from the 8A program and being a large and being able to compete. You know, we looked at how are we going to do that. So about 2 years ago, it was over 2 years and 4 months now, we decided that we were going to be a HubZone certified company. Today I can actually say after 2 years and 2 months, we met that criteria. It was a significant investment, but we are here. So I look forward to being able to work with everybody, I hope.
Hi, I'm Peg Stessman, and I'm with Strategic Health Solutions. We've been in business just a little over 11 years, so it's been a very fast, hard, and exciting time. Our work with CMS is similar, I guess, as Sean's, in that we are clinical in nature, and yet we also do a significant amount of education and training and some systems integration. So we have a variety of different skill sets that are employed at Strategic as well. Most of those being clinical, but because of the education and training component, also we have folks like graphic artists and technical writers and all of those. Strategic was founded as a small woman-owned business, so we didn't ever have the luxury of the 8A. So if you can get that, I would say go there. Because sole source at that point, although now today you can get a sole source as a small woman-owned, but at that point you could not. We too did graduate, so be careful what you ask for, because graduation is a great thing in that it means that you've been successful, but it also is sometimes scary. I like to say that we're too big to be a small, but too small to be a big. We're in that danger zone in the middle. But we have enjoyed a wonderful relationship with CMS, and as I know all my colleagues as well, we still hold some of those original contracts that were awarded way back in the day. And it's great to be able to have contracts for 10 and 11 years and counting. Thank you.
Hello, my name is Leah Heimbach, and I'm a principal with Healthcare Management Solutions. We're located in North Central West Virginia, and we have offices in Columbia, Maryland. We were established August of 2002. We've been in business 14 years and 3 months. Excuse me. We were initially classified as woman-owned 8A, graduated in February 2014, and as Peg said, it's a very daunting thing to have happen. You enjoy the success of making it through the program and growing, and I congratulate all of you who are trying to make a footprint within CMS. My advice is stick with it. It's well worth it. We have a capability that kind of is a unique combination. We have purposeful integration of IT and clinical expertise. A substantial part of our work involves conducting healthcare facility inspections throughout the country. They're called surveys in the world of CMS, but those aren't paper-based. We have an incredible staff located throughout the U.S. who go on site and inspect for compliance with Medicare regulations, end-stage renal disease facilities, hospitals, hospices, organ transplant programs, and nursing homes. We also do compliance audits and reviews pursuant to the Affordable Care Act. We also do some medical review. More recently, we're getting into supporting state agencies and management transformation and support. We've been actually lucky enough to be approached by states because of the quality of the work that we do to help provide them solutions to the challenges they're facing. We do data management or data validation and some medical review, and also a lot of health IT systems work specific to healthcare focuses. The only thing that I would also challenge you to think about is as you are getting into CMS, and if you're lucky enough to get into the 8A program, you need to prepare really early for when you deal with getting out of the 8A program, and like 5 years before you're scheduled to graduate, because it is a big challenge of not being big enough to get off the porch and run with the big dogs, as they say at home, but you can't compete with the smalls either. So thanks for having us here today, and good to talk with you.
Hi, I'm Mike Carrier. I'm the chairman of the board at Ventec Solutions. We're a graduated 8A. September 24th of this year, we graduated from the 8A program. We are still small for the time being, but we have enough awards pending that we could rapidly blow out of that category. What is it we do? We've got 5 areas that we've kind of organized the company around and focused on. One, obviously, is infrastructure support. Many of you know that we recently were awarded the HICS contract, and kind of, if I could quote, G2X came out of the blue to take that contract. And I'll talk a little bit as we go through here as to how we were successful in winning that contract. But infrastructure support's one of the things we do. We also do software development. We do legacy systems modernization. Everything from legacy COBOL code conversion to infrastructure conversion to and working with clients to upgrade and modernize that. We've got clients out in Chicago with the Railroad Retirement Board doing that. We're doing it for the Air Force, and we're doing it for the Department of Defense. We also do data analytics and data analysis, working with some huge multi-terabyte databases for various agencies, including those here at CMS, as well as cybersecurity. We've been in business for some 24 years. We've been at CMS now for 2 years, but prior to that, my background is, I came out of the federal government. I've been doing this for large and small businesses for a number of years, and with a previous company, I had worked here at CMS for about 6 or 7 years before we went over there. We were originally classified as an 8A contractor. As I said, we graduated on September 24th, and right now we're classified as a small business. And I think the rest of the questions, we've got a whole list of questions here that we're going to ask, so I'll turn it back over to Teresa and let her get to those.
Great. Thank you so much. A lot was mentioned about the 8A program. CMS does utilize the 8A program a lot. We do a lot of set-asides. Our contracting officers do look at that. We do a lot of small business contracting, as you learned earlier. But you do have to be prepared to lose that contract eventually once you graduate from the program. A lot of the companies really, it's hard for them to swallow that, because they've had that contract for 5 years and now they're graduating from the program. Once it's in the 8A program, generally it stays in the 8A program. So you won't be able to keep that contract. So you have to, like Leah was saying, you have to kind of start planning early. So I'm going to jump, I do have some prepared questions, but I'm going to jump around a little bit. So we talked a lot about the 8A program. What would you suggest, the panel, when would you suggest would be a good time to get into the 8A program? Would it be right away as you become a company, or would you wait a few years? What would you suggest? And Mike, we can start with you.
Well, that's kind of a tough question. There are advantages to both. My recommendation would be to spend a year or so to kind of get your feet wet and figure out what the market environment is, figure out what you want to be when you grow up. I mean, I think a lot of small businesses start out and when they ask them, it says, what do you want to do? And their answer is make money. And while that's a good answer, you need to figure out, okay, the how part of that. And the 8A program is a good one to do that. I would also recommend that when you're making that decision, that you go to your local small business agency and organization. You know, we started our corporate headquarters were originally in Columbus, Ohio. We're now here in Baltimore, just outside the gate. But we had a very good small business representative at the SBA out there in Columbus, Ohio, and she worked side by side with Ravi Kanduru, our owner, and kind of walked him through that process. We've been in business for 24 years, but yet we just graduated from the 8A program. So our path was, we didn't start out that way. We did a lot of commercial work, and then we decided that when we decided to move away from commercial, back when the economy tanked a few years ago, we got involved in the 8A program.
Great, thank you. Leah or Sean or Mike, 8A, former 8As?
Well, certainly the 8A program has its advantages, and I don't know that the moment you start your company that you would want to go out immediately and apply the 8A to be in the 8A program. I know I believe now there's some requirements that you have to be in business a certain amount of time before you can. But Mike said a really important thing. When I look back 14 years ago about knowing what we do and what we do well, you do have to have your identity sort of figured out, and more importantly, figure out what agencies, what you do, make the most sense as far as a fit. The 8A program obviously is good for a sole source process because we didn't do commercial work much. We had an initial contract that was in the state of West Virginia helping the 54 health departments comply or get ready for compliance with the HIPAA privacy rule. Well, when that engagement was finished, it was a difficult situation for us to figure out, okay, do you go commercial? Do you try and continue to work with the state government that you're in? So we spent a lot of time talking to 8A companies who had achieved it and what that involved, how long it took, what they were successful at, what they weren't, because sometimes you do get turned down. So it's a good thing to do it as early as you can, but finding your identity and what agency or agencies you're going to target, I think, is crucial. And then also working with your local SBA rep is also an important component because they can help you navigate the regulatory process of becoming 8A.
I'd suggest a little later, only because I think you need the infrastructure in your environment in order to do that. There's a lot of compliance regulations that you have to do, not only in working with the federal government, but just for the 8A program alone. I mean, we would prepare annually. I don't know what yours look like, but by the time we got done, the last year that we did it, there were 2 binders this deep of information that we have to provide. The review is significant. It takes significant resources to be able to support the regulatory confinements that you have of the program. And that's true even in working with the federal government.
My recommendation would be as soon as possible. But as soon as possible, I believe the SBA regulations stipulate you have to be in business for 2 years prior to applying. So as soon as possible, you're in business for 2 years already. But I say as soon as possible because it could be a sole-sourced opportunity that could establish your company as a solid performer and lead to future growth. But, you know, as everybody's already said, don't think that work is just going to find its way to you because you've entered the 8A program. You have to be prepared to go out and pursue the work.
Great, that's great advice. Thank you. So along those lines, a lot of you who I've talked to are really struggling to get that first contract. So what would you say what obstacles did you face by meeting with CMS and getting that first contract with CMS, and how did you overcome those obstacles? And Peg, I'm going to start with you.
Certainly with getting the first contract is actually understanding how to bid. The requirements for a bid are, for some that are new to it, is like going to a foreign country and trying to speak English and hoping everyone else understands you. They are very complicated and you need to comply. You learn very quickly that the government is always right. So suggesting to them that their criteria is wrong is not a winning solution. Finding your program manager. I can't tell you how many times we've looked at a bid and said a go, no go based on could we find, this unique unicorn that has been defined as the program manager. Because that person isn't necessarily just sitting waiting in one of your cubicles for you to bestow upon them this title of program manager. So I think from our standpoint, I had run a previous company, so I had the relationships with the government from that previous organization, but then getting the government to trust that I could be my own company by being able to perform, demonstrating that I had the financial backing, demonstrating that we had the systems that would be able to manage my timekeeping and finances. All of those components are things that you have to present to the government, as well as, but we're really good at X, Y, and Z. That's one part, being good at something, but the other part is all the backroom stuff that you have to have, and you have to be able to demonstrate that you can be trusted to follow through and to perform.
If I could piggyback on that a little bit, I kind of took it a little bit of a different tact on that, and I said that probably the biggest obstacle that I see with a lot of small businesses is that they don't make the investment up front. They were talking this morning in the session, and I forget who said it was, hey, we do a lot of cost-plus contracts. How many people out here use QuickBooks? Okay. My recommendation is, QuickBooks could be a compliant system, but there are other systems out there that are more readily identifiable in the marketplace. If you walk into someone and say, hey, we use Deltek. Well, that's kind of like, I don't know whether any of you remember it, but a few years ago there was a commercial where the guy drives up in a car and he's getting out and people are kicking the tires and slamming the doors, and the guy says, oh, it's a Subaru. And everybody went, oh, it's a Subaru, and they walked away. Well, there are certain products in the marketplace that are akin to that. So you need to make that investment up front in your infrastructure, financial, your HR, those kinds of things like that. The other thing that I think a lot of companies face in getting into marketplaces, she mentioned that she had prior contacts in the government. Well, you may not have those contacts in the agency you want to get into, but if you want to get into, then you need to hire somebody that does. Bring somebody on board. How many people out here are their owners? They're the BD person, they're the accounting and finance person, they're the HR person, they're all those things. Well, at some point in your career or your company development, you need to make a decision and kind of segment those things. So I think you need to invest in a good BD person. You need to invest in a good HR person to help you with those tasks.
Anybody else want to add anything?
For those of us who weren't lucky enough to have government contacts when we started, and we didn't know anything about working in the federal government, you got to get started somewhere. And I agree with everything everyone said. You have to invest in infrastructure, but when you're a two-person shop or a one-person shop and you're trying to get your business off the ground, it's really hard to go out and get a loan to hire a BD person, an HR person, and an accounting system and all those kind of things. You got to take baby steps. And for us, we went to vendor outreach after vendor outreach after vendor outreach until finally someone in the government said, oh, hey, good to see you again. And so they begin to engage you and trust you. And again, getting information from other companies who are in different developmental stages is also helpful, because you can't go out and do all those infrastructure investments immediately. It can be gradual, and you do wear many hats, but you do have to make a commitment to making those investments, whether it's gradual or not.
Okay, so she's got a really valid point, particularly when I can remember meeting with a small business specialist that said to me, you know, you really need to think about being an 8A. And then, of course, I went and read all the regs and said, oh, I actually can do this. But I also remember hearing about there's these companies and there are these two women that own, and by the way, it was both of you, but one of them happened to be Patty and Leah. And they said, you know, I think you really should talk to that person, and so you better pick up the phone and go talk to the person. And of course, I called, and I'm on the phone with Leah and her partner, Patty, and they said, well, can you send me a CAPE statement? I said, what's a CAPE statement? And I'll never forget it. And she said, okay, go to our website, Sean, pull this up, because in the commercial sector, it's not called a CAPE statement. And I went, oh, that's a marketing flyer. In the government, it's a CAPE statement. So, you know, I learned a lot, but I had to be willing to learn, and from every person that I talked to. So I think you had a very valid point. And by the way, thank you again.
I can't really add anything because I think we were in a rather unique position, and maybe the procurement rules were different in 1999. But one of the partners in Adaptive had a small piece of work at CMS prior to forming the company, and then the company was formed in response to having that piece of work. So in terms of obstacles to our first contract, there really were none. And then, you know, soon after the first contract and the formation of the company, we got a couple smaller jobs, but you know, from that point forward, it took a lot of effort to get larger and more meaningful contracts.
Great, thanks. So some of you obviously have talked about partners. Can you tell me how heavily did you rely on partners, whether it was large business partners or other small business partners, throughout your work here at CMS?
Okay, I don't want to hog the microphone, but I'll go ahead and kick off and say that partners are essential. But one thing I'll caution you when you go to the partners, it's like Teresa Lewis said this morning in the presentation, you know, don't show up and say, hey, I'm an 8A, give me a contract. You know, the way I like to work with partners, and I've been with large businesses before, I've been with small businesses, I've been on the government side. You know, typically when you go to somebody's house for dinner, my mother always taught me you take flowers for the lady of the house and you bring a bottle of wine for dinner. Well, when you go to visit a large business, think the same mindset. If you go to the large business and say, hey, we're in 8A, bring us on your team, give us some work, they're just going to look at you. You know, if you go in there and say, hey, we're nice guys, they might bring you on, you know. But if you go in there and say, hey, I've been marketing this piece of work at CMS, or I've got an idea, or I have a really neat way of doing something, they're going to be much more receptive to you. So when you go to the partners, and partners are critical, they're essential. I mean, when we won the Hickus contract, we had a large business partner on it, HP is part of our partner. We had other partners too. You know, and when we went after other work, we've had other large businesses on it. So partners are essential.
Anybody else?
I would just say, at least for us, our first contract was a subcontract. That was our entry point in. And it was a situation where the business had gone to a small set aside, and the large needed a small to put on top. That small, we were lucky enough to be us. But that large business is who mentored us, who got us introduced really to CMS from a contracting standpoint, and who taught us the work, because we literally knew nothing about the work. We had to have a crash course on, you know, it was education and training, and they were talking about storyboards and all these different mediums that education could be put in. And we were like going to Google, looking the stuff up in the corner, because we had no idea what they were even talking about. But that large taught us how to do this, and over the years we kept that large in place because that is the right thing to do. And you know, today we still have that contract. It's, you know, we're responsible for about 75% of all the educational products that CMS puts out on their Medicare Learning Network, and that came from really a gift from a large.
I would say we've relied on partners extensively, and you know, from the inception of our company, we took the stance that we always wanted to prime And after winning a few smaller contracts at CMS, we gained a reputation for a solid performer, and we networked and formed relationships with large established CMS contractors. And when you're small and pursuing work that you haven't been involved in the past, the subject matter expertise of a large, it's critical in putting together good strategy and proposal, as well as, if you win, in staffing the project. And in addition, if you have an established partner behind you, it gives the government more confidence that you'll be able to deliver as a small business.
Great. So Mike mentioned performance. So as you are, get your first contract, if you are, getting a good, solid past performance is really critical, because that's going to be really factored in for future contracts. So in terms of performance, as a small business, maybe some of your earlier contracts, what were some of your challenges on performing on a government contract? And I guess I can start with Leah or Sean.
We had some interesting ones, because moving into the federal government, you didn't know really kind of what you didn't know, right? So one of them was the government-approved accounting system. Our very first contract at CMS was cost reimbursement. And of course, here I was, a small company that also had audited financial statements, so I thought, I'm good to go, right? No. And so that was interesting. That was probably one of the first challenges that we had. It didn't impact CPARs, but everybody said, okay, Sean, you need to do this. And we turned around and we hired a consultant to make sure that we could come into compliance in that way. So we took care of that. Another one was a partnering decision. You're kind of talking about partners, but it created a challenge for us. We probably chose the wrong partner in one of the first contracts that we had as a small business for our IT systems. And, your IT systems, particularly at CMS, you've got to go through an authority to operate. You have to be able to go through the security control assessments. And I will tell you, we had a significant issue. At one point, we had 124 findings. Yes, I did record that. By the time the final report came out, though, we had 9. So we had cleaned them all up. But there were a couple of findings, and we worked with the government to solve that. We also made changes. We moved our data center. There were significant changes that we did. As a result, today, the last 2 SCAs that we've gone through, I think the last one of this year, we had 0 findings. The one before, we had 3. It was a moderate and too low, and once the report was filed, the moderate closed. That's all we needed to do. Big difference from where we were, but it was a challenge. The other challenge that we had, as long as I'm being so open and transparent, it's my way, was we took over a contract that had significant backlog. And those of you that are contracting officials here at CMS, most of you as directors know this, it had a backlog of cases that were over 15,000 cases. And we took it over. We knew we were supposed to clean it up in 6 months. We had accommodated the time that we thought that it would take to do it, but what we didn't know is what the cases were when we got them. So when we actually got them, instead of them being a normal type review case that would take maybe 45 minutes to do, the prior company, and I don't think it was all on their side, I think they were trying to be as efficient and effective as possible given the contract constraints that they had, they left all the complicated cases. One of the cases alone, I'll never forget this day, one of the cases alone took 9 hours to do. There were thousands of pages to that one case. Fortunately, we were open and transparent with the government. They did work with us, and we did find a solution to taking care of that. Today, the stakeholders are very happy with the work that we were doing, but it was a significant issue. And then I can remember, Teresa, one time, we came up with this solution that saved the government over $2 million. It was a great solution. But I forgot to negotiate a change in the time period for the number of days for 2 parts of this. And I remember calling you going, I cannot believe I did this, and I signed this mod, and I was stuck with it for the next year, and it showed up on my CPARs. I knew it. She laughed. I knew. I laughed, but it's not funny. I mean, on the CPARs it wasn't, because I wanted to be in compliance and I really wanted to do a great job. Overall, we saved $2 million, which the government appreciated, and overall in that project, we've saved over $12 billion today. So it's okay, and the government has kind of forgiven me for that mistake, but at the time with the CPARs, it was a big challenge for us. So there you go. You can work through it. They're reasonable people.
Anybody else? Okay.
Well, two thoughts. One, performance and past performance is crucial. I mean, it's the bread and butter. Everybody's going to look at what you did, the grades you got, before they're looking at awarding to you moving forward. Two things about this I think is important. One is the concept of recency is primacy. You're only as good as your last deliverable. So you could have done really good things for the entire last 9 months. Something goes awry towards the end of that contract year, and it's CPAR's time. So one of the ways we've been able to approach that is long before it's CPAR's time, and I know there's a much stronger concerted effort within and throughout CMS to get CPARs done in a more timely fashion. We ensure we maintain consistent and regular communication with the program staff to say, how are we doing? Well, on a couple of occasions, Patty or I have made meetings with program staff and said, how are we doing? Is there anything you'd like us to do differently or better? And you get a surprise. They weren't very happy about something, but had we not asked the question, we wouldn't have known. And you can imagine how that could impact your CPAR. So meet frequently as you can, every other month, every quarter, to ask how you're doing. Listen when the customer expresses dissatisfaction or not liking what direction you're heading in. The other thing is, and we do this, and CMS doesn't have to accept it, with the program person on CMS's side, our project managers will prepare information for them a couple or 3 months before we know the CPARs is due and say, as you're beginning to do your CPARs evaluation for HMS, here are some things we'd like you to consider. And it encompasses what transpired over the entire contract year, not recency is primacy. So that's a piece of information I would suggest.
Anybody else want to add anything?
In terms of obstacles you overcome at the beginning, I think probably from our perspective, probably the number one obstacle is finding good people. Infrastructure stuff, that's critical, that's important. You absolutely have to have that stuff. But if you have a situation where you bring someone on who's not a good fit for either technology-wise, cultural fit, and I think cultural fit is a big issue. If you're in there and you're trying to, as some of the panelists have said, you want to do a good job. Nobody takes on a contract and says, hey, I want to fail in this. You want to do a good job. But if you have someone that you put in there who may be technically competent, but it's not a map to your mindset, to your culture, to your corporate culture that you want to convey to this customer, this client, that could be a recipe for disaster. So I think hiring your program manager, hiring people that support the program manager, and finding people who map to the customer mission, the customer mindset, and to your culture are some of the biggest obstacles you face when you're starting a new contract.
I was going to say essentially the same thing, but just to add, at the same time, remaining cost competitive.
That's a great point.
Oh yeah, that too.
So I want to, this is my favorite question. So I think back of myself, what I would do different if I knew now what I knew then. So think back to your first contract. If you knew then what you know now, what would you do different? Peg, I'm going to start with you.
That's a tough one. Certainly, there have been contracts, I don't know if it happened with the first one, but there have been contracts where it's been very difficult to staff, to find the right number of people and those right people with the culture and the skill set that CMS is looking for. So in my case, one of the things that if I got to do over again, it would be really hiring the right HR person in your company to make sure that you have the recruiting power that you need to staff up. Sometimes contracts require you to go out and hire maybe 25 or 50 people. And you might think you can do that by simply placing some ads and somebody will just magically come and you'll be able to get all those little slots filled. Whatever dollars that you need to spend on recruiting, spend them, because your performance will be impacted if you don't have the people, the right people, and the right number of people in the seats prepared and ready to do the job. So I guess I would say really invest in your HR resources and make sure that you have the benefits that are going to be competitive to be able to attract the people that you need.
I think I've been doing this for a long time, so I think if I had to do it over again, I would have realized that buggy whips didn't have a future and probably wouldn't have been chasing that contract. I think that's kind of a different way of saying that you need to do your homework. When I first made a call on one particular client I'm thinking about, I wasn't prepared. I mean, I went in there and it was kind of like, "Hi, I'm here." And he said, "Well, why did you want to see me?" And I kind of got this blank look because I hadn't prepared. You know, I wasn't ready for that kind of a question. So I think, you know, probably when you're going to go see a potential client, a prospective client, be ready for that kind of question. You know, if you call on the phone and say, "Hey, I want to come see you," be ready for the question to say, "Why?" And be ready to answer that in terms of what you do and what they need.
So the question was, if you knew then what you knew now, what would you do different, right?
Right.
So my first answer was pursue private sector work. But that was a joke. So things have worked out pretty well for us, but the first thing I could think of was to seek out an established large business as a formal mentor, because there's a lot to learn, and a lot of times you don't know what you need to learn, and that can become evident from a large mentor.
When I think back, I deliver what we hadn't done, which is something that we do every day now. When we put our proposal solution together, we had not actually done all of the workflows for how we were going to do all of the work. Today, before we submit a proposal, we make sure that we have all of that in place. And the reason I say that is that contract came up and it ran, and the methodologies that we typically would use were not followed. And that it was interesting. I mean, in the end, everything was okay. I let the person go. Met with a client, we got everything all taken care of, but today I'd make sure that that person that you're going to put, that program person, really understands the environment that you're in, number one, to deliver, and then number two, that those workflows and things are done ahead of time. Our first contract they were, and we were very successful with it. They were a couple that happened a few years later.
Okay. So we have, I'm just checking the time, we have about 4 more minutes, and then we're going to be opening it up to the floor for you guys to have questions. We will have folks around with microphones for you to ask questions. But there's a couple more I want to ask. And so this is a pretty big question, but what would you say, if you could just think of a few words, what would you say the key to your success was? Yeah.
Good staff, admitting mistakes and offering solutions and disclosing them to your customer. And we actually have these rules we live by, and they're our core values. They're on our website. Everybody in our staff that gets hired gets one of these. We tape them to our computers. We don't get it right every time, but the expectation is everybody at every level lives by them. Accepting responsibility for outcomes, acting with integrity. You got to have a good culture and promulgate that culture. And if you do, you succeed. And you have to stick with it even when it's hard.
Mike?
Yeah, I think our CEO, Herb Jones, has got a phrase he uses all the time, and he says, "Facts are our friends." And I think that's kind of the key to our success. I think that you can look at a situation and you can deal with it emotionally, or you can stop and take a deep breath and look at and say, what are the facts? What are we dealing with? Focus on the facts and figure out how to solve it. And I think that's the key to success. I think without any kind of hesitation, you make the statement that every program that you get involved with, every contract that you win is going to have issues. It's how you deal with them and how you move forward from those issues that make the difference as to whether you win the recompete or whether the recompete goes to somebody else.
Anybody else add to that? No?
I'm not sure it really is success. I think it's more of a journey. And so I look at it a little differently. There's milestones for each piece, and maybe it just might be my approach, but I think we break it down into the milestones and look at it as that. We listen to our clients. I think one of the things is I'm willing to learn. And I think our entire group, our culture, our corporate culture is very compliant by nature, but there's also an element of continuous quality improvement. And it's supported. We have URAC IRO accreditation as an independent review organization. I'm sorry. Those that aren't clinical wouldn't know what it is. I'm sorry. We have ISO accreditation, and we also are in the process of putting CMMI for a level 3 in. But it's that culture of continuous quality improvement. We do a lot of lessons learned, best practices. Even if the government doesn't ask us to do a lessons learned report, we do internally.
Peg or Mike, add anything?
I would just say that I agree, because it depends on what stage you are in the business, what leads to your next success. I mean, in our early years, we had small contracts, so that helped us establish relationships with the CMS management. We got some name recognition. That led to the next step, which was forming relationships with existing large CMS contractors, which allowed us to go after more meaningful and larger opportunities. And then, at this stage, or several years ago, we established a mature business development and proposal team so we could, keep the ball rolling.
I would echo all the comments that everyone here has made, and add to it that it takes a lot of hard work. It's a lot of sleepless nights and a little luck.
Mm-hmm. Great, thank
Teresa,
you.
if I could, one second.
Sure.
One thing I wanted to add into it is I think the summation of a lot of the stuff we said, that the panel set up here, is you need to be ready for success. You talk about getting ISO in place, you talk about getting CMMI, you talk about hiring the HR person. If you want to be successful, you got to be ready for the success. You got to be saying in your mind, in your heart of hearts, when this proposal goes in to your process there, what happens if we win it? They said, oh my God, the good news is we won, right? The bad news is we won. Mm-hmm. You got to be ready. You got to be ready for that success.
Yeah, great, thank you. So we have about 15 minutes remaining until our break. So at this time, we want to open it up for all of you if you have any questions for the panelists. There are OAGM folks that are around with microphones. Just put your hand up and they'll come see you. Here's some couple questions up here.
I'm going to take the mic for 1 second. Number one, I've worked with many of these companies, and they are successful because they have integrity. They put their money where their mouth is, and they get the job done. And from a consumer's perspective, as a contracting officer, I'm paying you to get the job done, and that's my expectation. But there were a couple points that I want to piggyback on from our perspective, and one was the CPARs. And your past performance is so important, and we do love when you give us that feedback and you give it to us as we're going through it. I don't know about the rest of you, but I don't remember what I had for breakfast, more or less what happened 7 months ago. So the more you can share that information with us, the more it helps our folks and it helps you. The other perspective, when there is a problem, no one likes surprises, like I used to say to my children. I'm okay if you got the D. I'm not okay if I didn't know about it till report card time. Tell us, and that's really important, and that goes towards the business integrity. Tell us when there's a problem, admit when there's a problem, come with the solution. For many small businesses, they only deal with our program people. Bring contracts in. We are the third leg of that stool, and you need to involve us because we can help you and support you, and we do bring a different perspective. So don't just get stuck with, oh God, I don't want to tell my project officer or my core there's a problem. There are times where we don't know it, and we can help you. So bring contracts into it. Sean and a couple of the other people said half the time, you don't know what you don't know when you're starting as a small business. Get that large business mentor. We assume when you sign that contract that you know and understand every acquisition regulation clause you signed up for. When you come back a month later and say, oh, we can't do that FAR clause. So sad, too bad, you signed on the dotted line. Make sure you know what you've signed up for and you understand, and if that means bringing in your legal counsel or whomever you need to bring in, make sure when you've signed on that dotted line, you are prepared for the success of that contract and you're prepared from the contract's perspective. And last but not least, I did hear many people say they found somebody in the government who they could then use later on as the face to come back to us. And that is great. From the contracts world, make sure that you bring the right person. We don't care that so-and-so worked for the government for 22 years. Doesn't mean anything to me because I'm still sitting at my desk. Make sure you're bringing the right person to do that development. Make sure it's the right person that has the skill set and that represents your core goals of your organization, not just that we were a previous Fed. Quite frankly, we're a dime a dozen. There's 6,000 of us. Make sure you bring the right one to the party to represent your organization. That goes a long way. Thank you.
Hello, Sam Elias, Rely Group. We're a new A-Day. Our A-Day is valid until 2023. So if any of you are looking for a new A-Day, we also are very grateful to have 5 prime contracts, one from Teresa within CMS. And I've been listening very attentively, and what Mike mentioned about the infrastructure, I think every dime that we made, we put it back into the company in the last 3 years, and we have a Delta cost point system which has been audited by CMS, and we have a cost plus contract, plus we have a SCA contract that we did not really know that it would be an SCA. So I'm having a fixed price, cost plus, SCA contract, and if I didn't have that infrastructure set up, I would not be able to support these prime contracts. So I'm glad that I made those choice and put that money into that investment. One thing that I would like to ask the panel, you mentioned about HR recruiting, also program folks. That is the challenge that I'm seeing right now, that all right, how do we comply with all of these things, all of these regulations, because we are a government contractor, there's executive orders, there are regulations, there are VETS forms, and have you considered utilizing companies that does HR outsourcing completely? It's kind of a co-employment, and how does that view, because your employees become kind of their employee and they handle all the HR from onboarding to IRS tax filings. I don't know if you know what I'm talking about. I've been approached by some companies. Just wanted to get some feedback if you have experienced that, and if that's something would be a good thing to look at. So.
We at Ventec, we outsource our HR right now, but I will tell you, it's the same thing when you're entering into a relationship with another teaming partner. You need to pick the right company. We're on our second HR company because, quite frankly, the first company we hired came in and screwed things up. So we got rid of them, and we're on the second one, and it's working out fine. It's working out fine. We do have our own in-house recruiting staff, and we got like 7 recruiters. To the point of the panel earlier, you got to staff the programs when you win them. So we got like 7 recruiters, and we do that not just for us, but we also offer it externally. But the HR, we outsource that.
Great, thank you. Next question. There's a question right here. Oh, there you go.
Hi, my name's Rob Haley, and I'm with a company called Strategy Gen, and we focus on technical assistance and quality improvement, and we've been in the 8A program for 4 years. And so the 5 years that we have left, And we've been working with the CMS for the Hospital Engagement Network and the Hospital Improvement Innovation Network now as a subcontractor. And we also are a prime with HUD. And we have long relationships with companies. We've been working with a company as a subcontractor since 2011. We've been working with another company since 2009. And my question goes back to the formal mentoring program. Have any of you participated in the formal mentoring program? Got benefit from it? Have you all been mentors? We view our relationship with our company as informal mentors, but trying to think about, should we go to the next level and have a formal mentorship?
So I always wanted to be part of the mentor-protege program. It was actually one of our goals and one of our exit strategies. Because of the work that we do, particularly here at CMS, we have had a lot of conflict of interest. And because of that, or would have had organizational conflict of interest. So the key partners that it would have made sense for us to have a mentor-protege relationship with, we were not able to. But I think it's a great idea and it would have been a great exit strategy, and if you can do it, I think you should, and at some point, I would love to be a mentor.
Thank you. Next question. We have a lot of hands up. Whoever gets the microphone first.
Hi, thank you. One of the things you're focusing a lot on, past, and I want to focus a little bit on where you are today. So, for some of you. So, obviously, when you have a small business award, and then it goes large, we all know what you do. You flip. You go find a small to front you. You might rebadge your key personnel. You let the customer know, hey, we're still here. We're behind so-and-so. Hope we put in a good proposal. But what I'm interested more in is, what did you learn as, forget what you currently have, as you went after new business where you were competing with the large companies? What did you have to do differently in your company via personnel, processes, or technologies that you wish you would have done or that you did do to now compete in a new environment because you no longer have those past relationships from current work?
Well, if you're speaking from how did you prepare to grow to become a large business, that there's, the whole, we can talk about the infrastructure piece of that. But from getting new work that's no longer 8A or small, one of our largest successes has come from, because of our survey work, doing the health facility inspections, there are evolving needs, regulation changes that we saw anticipated knew were coming down the road, and we're able to help shape solutions on how to meet CMS's needs that enabled us to win full and open work that was similar in scope but much broader. I'm not sure if that answers your question. Is that what you meant from a work perspective or an IT infrastructure kind of standpoint?
Well, no, it's what you did is you helped shape an opportunity that you knew was coming. But I'm thinking more about, the way your company is structured, the people you hire, the technologies you have as a company structure. Because I know there's probably a lot of companies in this room. I mean, I just did a survey the other day of a whole bunch of 8A companies in CMS. I was looking for one. Every single one, except maybe one, that had done work in CMS that wasn't 8A was no longer an 8A. So I'm like thinking, oh my gosh, there's all these 8As out there that have graduated now. How are you going to grow your business that you don't have that kind of, help in front of you by having that small? I mean, what do you do differently as a company and how you're organized, how you approach the work?
The difficulties have been that when you're in a position where you're no longer in 8A, you can't even bid on full and open work because it comes out on a vehicle that you don't have. So, at that point, there's really, you're excluded. And, we hope that Spark is the remedy to that in the near term, but we'll see.
But he also makes another interesting point. Contracting vehicles that you need to go after and pursue, such as GSA schedules, that's another way you can look at competing for other work once you've graduated from 8A. From a structure standpoint, we didn't change our organizational structure from a legal standpoint, but our leadership team has changed, evolved, new things added as priorities changed, opportunities arose. So that flexibility, I think, is important in how you approach and step back and do strategic planning for your company. What did we do right last year? What did we not do right? What do we need to be thinking about going forward? Those kinds of things.
Okay, we have time for maybe 2 more questions. So who have hands up?
Hi, I'm Anupam from Avenues. We are not an 8A company, and because of the size, we can't even get 8A. It seems that most of the companies here are 8A. So what do you suggest for companies like us, which are new to CMS? Do you think we can get any business from here? Apparently, 8A is what seems to be quite a requirement. Or what is your thought for companies like us to get any business from CMS?
I would say first look at subcontracting opportunities, partner with small businesses and 8As, and as well if you have something to offer to existing large primes, seek those primes out.
Yeah.
I just wanted to add a little bit to that. You don't have to be an 8A. We do a lot of total small business set-aside contracting as well. We do a lot of contracting with 8A companies, but it's not a requirement. So I totally agree with Mike. Look at some subcontracting. There's networking that's going to be available. A lot of our large businesses are here today. I would suggest that you reach out to some of them, but absolutely, it's not a requirement to be an 8A to get business here at CMS. I think we have time for maybe one more question.
Hi, Nick Foley with DS Federal. You touched on this a little bit a couple questions ago, but as you've graduated out of the 8A program, what are some of the challenges you've faced and how did you address them?
Well, I think as you graduate out of the 8A program, first off, somebody on the panel mentioned it before, if you wait till you're graduating out of the 8A program, it's too late. You need to start looking towards graduation at about year 3 in the 8A program, and you need to position yourself. You need to go after stuff as a prime contractor and look. I mean, it's nice to get a job as a subcontractor, but I think my opinion is that if you approach every opportunity that comes out as, I'm going to prime this, then that's going to make you a much more valuable subcontractor, even if you don't ultimately end up priming it. Why? Because when you do that, you're approaching it from a different perspective in terms of how you attack it. You're looking at what the value is, what the benefit is, what's the value proposition that you bring to the table, so that when you go after a subcontracting role, you can address that. In terms of when you graduate, and that'll prepare you for when the time comes for when you graduate, because when you graduate, it's a cold, hard world out there. You're in those awkward teenage years. You're not an adult and you're not a kid anymore. So you have to go after stuff as a prime. Don't be afraid. Don't be afraid to put a bid in. Your chances of winning are 0 if you don't bid.
Right. Great.
They may not be much more than that if you do, but at least you tried. And go to the debrief. Someone mentioned that earlier. The contracting shop here at CMS, they're great. I mean, we've won stuff at CMS. We lost stuff at CMS. And when they debrief, take notes, pay attention. That's
great. Thank you so much. We are out of time, but I'm going to turn it back over to Carol, but I wanted to take an opportunity to thank this panel. It's been a great panel, great advice.
2 seconds. I know I stand between you and the cafeteria line. I do want to again thank the panel. They've put their heart and soul into their success, and they were willing to share it today with you, and I'm sure they'll be available in the lobby. Don't throw business cards at them. But I do want to thank them and thank Teresa for all the hard work she put in to prepare for the session. The slide will stay up so that they will not be blinded when they step away, and it will be available online. Please try and be ready for the 1 o'clock session. And you did hear several people talk about Deltec and cost accounting. There are 2 cost accounting sessions this afternoon to teach and educate on what you would need to be able to have a cost reimbursement contract in the federal government sector. There are meet and greet sessions one-on-one, again, if you have an appointment. There's networking out in the lobby with both our contracting officers, some of our program people, and the large business tables, and there's an NCMA session that will share an industry perspective with contracts, and contracts will share our perspective with industry. So thank you very much, and be on time for the 1 o'clock if you're attending a session. Thank you all.
Thank you.
Computer science.
And then they want to move in.
He's a school Milan. He's a computer systems admin. And my daughter's a teacher. Teaches first grade. At least I hope I didn't monopolize the conversation.
puertorriqueña. Yo te la traigo de Cupey, de Vega Baja y de Santurce, de toda parte de Puerto Rico. Esta bomba yo la dedico a toda mi gente de Puerto Rico, a la familia Fontanet, allá en Cupey Alto y Lo Mejía en Vega Baja. ¡Que gocen! Bomba, bomba, para siempre. Bomba, bomba está presente, aquí lo canta mi gente. Bomba, bomba, para siempre. Baila, baila y goza, mi bomba puertorriqueña. Bomba, bomba. Bomba, bomba. Bomba, bomba. Bomba, bomba. Bomba, bomba, para siempre.
Guten Abend, gut Nacht, mit Rosen bedeckt, mit Näglein besteckt, schlupf unter die Deck, morgen früh, wenn Gott will, wirst du wieder geweckt. Morgen früh, wenn Gott will, wirst du wieder geweckt. Guten Abend, gut Nacht, von Englein bewacht, die zeigen im Traum dir Christkindleins Baum. Schlaf nun selig und süß, schau im Traumsparadies. Schlaf nun selig und süß, schau im Traumsparadies.
This, it is.
Good afternoon. Please come on in and be seated so we can get started and stay on our schedule. So before we get started today in this event that we have coming up next, for those of you who are in the room, I'm going to give you a very important public service announcement. So during the course of the day, I've been getting a lot of questions about Spark and where we are with the vehicle. So anyone in the room want to hear about that? Okay. So what I want to say to you is that, of course, you already know we awarded the vehicle, received a protest on that particular vehicle, and that we are in the process now of still trying to finalize that and put the vehicle in place for use. So I know there's might be some rumors out there that we're not going to use the vehicle. We still are planning on using that vehicle. We have the need for that vehicle, so we are just right now going through the process. Can't really talk a lot about that process as we're going through that, when that protest starts and you start going through the legal process. So we can't really get into the details of where we are and what we're doing. But I do want to put to rest that we do have the need for the vehicle and we do plan on using it. Okay? All right. That's your public service announcement for the day. Now, for why we're really here. So first of all, I would like to take this opportunity to thank NCMA for working with us to put on this event on this kind of reverse industry day. We have been fortunate that we've been able to work with NCMA in a very collaborative way. First of all, I'd like to take this opportunity to thank Mr. Brian Hebel. Can you please stand up? Brian has been very instrumental for CMS along with many other people, but I particularly wanted to point out Brian because he had a lot of energy behind making this go forward. We started very small. I remember meeting in a little conference room one night with about 6 or 7 people around the table, and many of those people are here today, just trying to figure out how we were going to get started, how we were going to work together. And then I look at this Woodlawn chapter now. It is tremendous. And so today we have this opportunity to hear from industry and what they think about things that can help us. And so we invited many of our staff out to this meeting today so they can hear from industry and from you. But as you kept hearing for a theme for the day, we are in this together. We have to work collaboratively together. You kept hearing Melissa talk about transparency. We are trying to be more transparent. We have an initiative around our debriefings and providing more information so that when you get a debriefing, it is of value to you, that it will help you in the next phase moving forward. So when you go after that next piece of work, hopefully you'll have some lessons learned. With that same theme in mind, we're trying to have some lessons learned from industry today about things we need to know about as we move forward. So I see that we have some program people in the room that showed up today, some contract people in the room here to kick this off today. I would like to introduce David Levitt. He's our NCMA Woodlawn president. I do want to take the time to thank David. He has done a tremendous job in help growing this chapter. And so without further ado, David.
I want to thank Derek and CMS for all the assistance and work we've done together collaboratively to make the NCMA Woodlawn chapter what it is today. I'm the president of the Woodlawn chapter, and as the president of the Woodlawn chapter, I'm delighted to be here today to support this Industry Day event. Our support here today fits well with our mission and vision. The NCMA is organized around certifying acquisition professionals and educating acquisition professionals. And our vision in the Woodlawn chapter includes that NCMA vision, but it's a little bit broader and a little more focused on expanding the communication and understanding in the broader acquisition community, which I think corresponds with the big A that Melissa put up earlier today. Our chapter has grown from being a small chapter to something just over 400 members. About half of those members are federal government acquisition professionals, and many of those are from CMS. At the same time, we also have a lot of commercial acquisition professionals because it's important to the commercial community as well. And as a group, with our understanding to be, with our vision, we want today's session to be positive in terms of the results that everyone gets out of it. Our panel today will share their thoughts based on what we did in September and August. We did a survey of industry to find out what their thoughts are about acquisition, how it could be improved, what could be different for CMS. At the same time, we were introduced to the Professional Services Council, who's represented here today. They also have surveyed industry to find out what and how we could improve the acquisition environment. So, together, the NCMA Woodlawn chapter and the PSC put together this panel. For today's panel, we have Patty Hodges from HMS, who's behind me, unfortunately. And then we have Bradley Saul from the PSC, J.R. Glass from CSRA, Joan Hornstein from Accenture, and Phil Serene from Cognosante. Lastly, I want to thank the panel members for volunteering to do this today, and I want to thank Dan Kane for helping to organize the session today. And I also want to thank the Woodlawn chapter leadership, Dorothy Callahan, Mike Blake, Suzanne Charleston, and Alice Roach, for their help in getting today's event organized. And with that, I'd like to introduce Patty Hodges.
Good afternoon, everybody. This is kind of an interesting experiment, or if you will, to the Reverse Industry Day. So the first thing that I want to do is just do a little bit of a brief introduction of each of the panel members. As David said, my name is Patty Hodges. I'm one of the principals of Healthcare Management Solutions. Those of you who were here with us this morning heard Leah Heimbach, my business partner, talk about HMS, so I'll just leave it at that, and then we'll move on and start with Jen.
Hi, my name is Joan Harnstein. I'm with Accenture. Oh, hello. Is that better? Hi, thanks. My name is Joan Harnstein. I'm with Accenture. I am currently one of Accenture's leads for our work supporting CMS with the federally facilitated marketplace. Prior to that, I was Accenture's operations director for our civilian government practice, working with overseeing all of our contract management, program management, and financial operations for civilian agencies.
Hi, can you hear me? Good afternoon, I'm J.R. Glass. I'm Vice President for Business Development at CSRA. CSRA, we're very proud to have been supporting the agency for over 20 years. We are a relatively new company. We were formed when CSC spun off its government business, CS.gov, and they merged with SRA International. So we're approaching our one-year birthday, but as a firm, we've been supporting the agency for over 20 years. We have probably about 800 staff and consultants that support CMS programs today, and I'm very happy to be here on the panel. Thank you.
Good afternoon. My name is Bradley Saul. I'm Vice President for Civilian Agencies at the Professional Services Council. Many folks in government know us as PSC. However, I should make a distinction, of course, at HHS that we are not to be confused with the Program Support Center. But the Professional Services Council is an industry association that represents professional services and technology companies that do business with the federal government. We have over 400 member companies and have been around since 1972. As I mentioned, I lead our civilian agency advocacy work. In many ways, we are similar to NCMA in that we also provide education and facilitation opportunities for industry and government to talk together about improving acquisition outcomes. We are different in that we are entirely an industry-based organization and do not have government members, and we're also advocates for the broader contracting industry to both the administration and also Congress.
And I'm Phil Serene. I'm with Cognosante. I'm our Vice President of Client Services. We've worked for CMS programs for over 30 years. We've done a lot of work for state Medicaid programs. We're very involved in the implementation of marketplace programs here at CMS. We do a lot of work around health informatics, data standards, data analysis, systems development. So very happy to be here to support the event.
Great, thank you. Just a little bit about format. We're going to start off by just some general broad topics. I'm going to give a couple of opening comments and then some general topics that we'll ask our panel to respond to. But what we're really interested in is hearing from CMS, both OAGM and program. If there are things that you would like to ask so that we can reverse this industry day and allow industry to give feedback to you, that's the goal of this program. So we will open it up as soon as you are willing to step up and ask questions, and if not, we'll continue to have some topics that we will bring up and talk about as we go through this. Any questions? Okay. I just want to say that I do view this as a quality improvement, and I wanted to mention that it was really refreshing to hear when Karen talked this morning about the importance of working with contractors. And also hearing from Melissa about the importance of working well with contractors. And I will say, and I think I speak for many contractors in this room, that our experience with CMS, OAGM, and program has been very rewarding. It's always been collaborative, but in the spirit, I'm a nurse, of total quality management or total quality improvement, that there's always room for improvement. So the goal of this session is to try to have a healthy exchange of information so that, as David said and as Derek said, when we walk away, we all walk away with something new. So first of all, we're going to start with kind of a general topic. And I've asked the panel that we're not going to have everybody speak to every question. We'll add on as we see it necessary, but otherwise we'll just, keep going through the topics. So first off, is your interactions with CMS acquisition community? What type of communication seems to work well? And what kind of communication would you like to see improved? We'll start with Jane.
Sure. Thank you. And just to reiterate, having broad experience with a lot of civilian agencies, the acquisition process works very well here. If we come out with nothing, it would still work very well. But just in the interest of throwing out some ideas to consider. One of the activities that I've seen work very well and appreciated being part of is an open, I guess it's an industry day in conjunction with an RFI or information request, where industry can come in and just share ideas on technology, potential risks, trade-offs early on in the process before the SOW is shaped fully or before the acquisition process is fully kicked in. It serves, I think, two processes. One, I think it provides a lot of just broad, open perspective. If an organization has done a similar project, or even if they encountered issues with that type of project, it's an opportunity for them to share what could be pitfalls, what might be considerations, or things that could be worked into the acquisition process. What it also does, too, though, is I think it gives the industry organization the opportunity to be heard early in the process and feel like they got their points across. For example, if I think a particular risk is particularly important and needs to be considered, if ultimately CMS hears that and that's a choice that's made not to address that because CMS has a different perspective, at least you've had the chance to share that. And I do think as the procurement progresses, you feel more involved in the process and heard and potentially less likely to have a gripe or a protest at the end of the process. So that's one thing I've always appreciated being part of. Any other suggestions?
So I think just kind of stepping back a little bit, I think when you hear industry saying they want information early, and that some folks in industry will say, gosh, we're working on procurements and tracing opportunities 12, 18, sometimes 24 months, and to a government employee, you'd be like, we haven't said anything yet. What do you mean? How can you be applying for something that's not for 2 years? Well, of course, especially when it comes to recompetes, if you can look at Federal Procurement Data System or USA Spending or other places, if you know that there's a contractor working inside the agency that has a 1-year contract with 4 option years, okay, 5 years, it's coming up in 2018, this is 2016, all right, now we can think that potentially we have a solution here that may be different that we might want to be able to go for. And so I would just say that the industry has an acquisition process and a capture process that mirrors the government acquisition process. And understanding how important information is to everyone, not just one person trying to get in meet with you, but getting out information as much as you can on FBO or having access during the market research process to program managers is key in getting successful acquisition outcomes.
Yeah, I actually want to build on that idea. And I actually worked for the government for 15 years, and I've been on the industry side for 10. So I definitely have some thoughts on things industry can do a little bit better to help the government and vice versa. I think that concept of how far in front of a lot of these acquisitions industry gets was something I wasn't completely aware of when I was on the government side. And it's great that you guys put out the FY17 forecast. I'm sure every contractor in this room has kind of gobbled that up and has reviewed it in detail and is looking at things to actually get into motion. Some of those things are soon, some of those things are a little further out. But I think the level of communication around specific projects is actually pretty healthy. There's events like this and other things where you can kind of learn what's going on. I think really just knowing what procurements are coming and things like vehicle is so valuable to the contractor community. And if those forecasts can be very reliable, very regular, maybe even 2 years out, I think the government can look at that mechanism as basically free R&D from the contractor community. There will be lots of companies who see an opportunity in 2 years. We will start to investigate it. We'll start to talk to partners. We will start to evaluate technologies and proven solutions that work and start figuring things out for the government. So even something as simple as a FY17 acquisition spreadsheet that you guys just put out a couple weeks ago, that's an incredibly valuable tool for the contractor community, but ultimately for the federal government, because you are getting us working on these problems way ahead of time, and you're going to get better proposals, you're going to get better solutions. So I'm a huge believer in that, and I think that's something that I want to see, CMS continue to do, and it's great that you guys had a great start a couple of weeks ago, and I think that should be a very important mechanism moving forward.
And building on what the others have said, us as a contractor community, we want to hear what your issues and challenges are. Some things that I've seen that worked really effectively in the past, particularly if it's a new procurement, a new acquisition, new work, is to hold a procurement-specific industry day where we can hear from the program managers and the people who are going to be responsible on the government side for delivering this work. And what are your big challenges? Is it technology? Is it process? That really informs our ability to craft solutions to best meet your needs. So that kind of interaction is very, very helpful.
And I just want to add that I do believe that, we have had a lot of success in having good communications with CMS in general prior to solicitation. So I think that in the big scheme of things, CMS does really well with having those conversations. But as always, there's always opportunities for that to improve. So I would agree. Let me just stop for a minute. Are there any comments, questions that anybody would like to make specific to that? Yes, we have somebody standing.
Not to that, but I do have a question.
Okay, go ahead.
Melissa Sterinsky talked this morning about looking at the debriefing process and making improvements on that. And I've had many questions recently. By the way, those that don't know me, I'm the small business specialist here. I'm Anita Allen. And Patty, you may want to speak to this too. There's been some awards made recently here at CMS, and a lot of companies are coming to me saying, well, it was awarded on the schedules, and the FAR doesn't require a formal debriefing. So I would like for you all to speak to it, both large and small, not just schedule buys, but the debriefing process. Since what are your suggestions? What is industry's suggestions on how CMS can improve that debriefing process?
Okay. You guys want to take a shot?
Thanks. That's a great question. So for industry, we really value CMS as a client, and we invest a lot of time and effort and resources to prepare proposals for you. And we understand we don't always win, but for us to continue to support, it's important for us to get a debriefing because it lets us know, what did we do right, what did we do wrong, so that the next time we're getting a little better. It's a learning process. So I've been on the receiving ends of debriefings that were 8 or 10 pages thick, which were great. And then I've gotten some on a schedule buy that just says the other company was the best value. And it makes it harder for us to fight the good fight internally, especially in a large company, of why we should continue to invest our resources when we're not getting any feedback. So the more information CMS can provide the contractors about our strengths, weaknesses, deficiencies, the better it's going to make us. You're going to see improved proposals submitted to you, and ultimately we think that'll make the CMS be happier and get better results with the programs that are awarded.
So I'll build on that too. One of the things that I would say is really a well-provided debriefing is critical to instilling confidence in the source selection process among all participants. And I know that debriefings come often in many shapes and sizes. Obviously, an in-person debriefing or even over the phone provides a better confidence, a better quality of information that would potentially, hopefully, reduce the likelihood of a protest rather than encourage one. One of the things that the Professional Services Council and other organizations have done is work with other civilian agencies to as they refine that debriefing process, is actually get together with industry and government to mock out and do a mock debriefing session and give feedback on, well, based on what you said here, I don't think that that's good enough, or tell me more about that, and so that it helps to standardize and redefine and give feedback without anything at stake, not a thing on the table when a particular acquisition, to refine and then eventually come up with a more thorough training procedure for acquisition officials. So I would suggest as a perhaps outcome of this is for NCMA and the Professional Services Council to work with CMS to potentially do some kind of a mock debriefing session to refine what those procedures would be.
Just one minor comment. I totally agree with the points made here. To speak from my perspective, I never aspire to submit a proposal that's excessive or non-compliant or in any way misses the mark. So I think knowing that we're all trying to give give CMS exactly what CMS is looking for, those debriefs really help us narrow the target, and I think ultimately improve the competitive responses that CMS is getting, and might ultimately lead to a better option from a selection standpoint for CMS. So we do really value it, and I agree with all the comments made prior.
I just want to add quickly, I actually want to compliment the CMS team on the debriefing process. Ours, for the very few that we lost, ours are very timely, very specific, very helpful. We do a lot of work for state governments and go after a lot of state business as well. And in many cases, it's a little less clear. So I think CMS does a good job of that process.
And speaking from a small business perspective, I think that what typically has happened with us is that you have the option, except if it's under a schedule, of getting a written or an oral debriefing. And the oral debriefing or the verbal debriefing really is helpful if it can be a discussion. Sometimes that happens, but more times than not, it does not. We just basically get the same thing that you would get in writing, except that you get it over the phone. So in those cases, sometimes it's better to have what's in writing, and then you don't have to take a lot of notes when you're listening to it. I think what would be most helpful, even with the schedule, because we have gotten a written debrief, even though when it's awarded on a schedule, it's not necessarily required, is that if you could just get some feedback, some clarification, because in a lot of cases, the strengths are there, the weaknesses are there, but when you read it, you're like, I don't understand. It's not quite as clear as what maybe it was by the person who wrote it. So if there could even be that second step where there could be a conversation to have some clarification, I think it would go very far in helping small businesses, and I'm sure large businesses as well, to learn from it so that the next time around we can do a better job. So that would be the piece that I would add. But I do believe that the briefing does well, yes.
So tell me from an organizational perspective, when we provide you with the debriefing, what do you do back in your organization, and how do you disseminate the information so that it is not so specific to the one procurement? Because I'm assuming you have teams that work on a specific procurement. So what do you do internally to disseminate so that it is valuable for the next one that might be, one is for CMMI and one is for CMCS? What do you do internally?
Could you kind of repeat that? Because Carol, I don't know if your microphone's on for people who are listening on YouTube.
Okay, I think Carol's question was, how do we take the debrief that we get and disseminate it to more than just the team who may have been working on that one procurement, so that the lessons learned go beyond just that team and just that proposal and can have an impact on future proposal responses, regardless of whether it's in the same area or not. And so I'll take a quick answer to that first. And I think what we try to do is we look at it specifically first to the procurement that it addresses, but then we try to broaden it. And I think that's where the specificity comes in. So if it's related to a technical aspect, okay, so are we clear on where we missed the mark, or what did we not have, or what did we not do, or what did we not say? Because in many cases, it's not really that you can't do it, it's just that you weren't clear in how you said it. But those are the areas where I think if we could seek specificity about it, the impact that it would have going forward on future procurements or future responses would really, really be helpful. Personnel, the same way. And we try to look at those in general. I know for us, we try to distribute that information to all of our proposal team so that it just doesn't impact or just doesn't go to the one group that wrote for that particular work, but to anyone involved in our proposal team so that they can hopefully learn. We also try to have meetings together to talk about it and how it might impact any future responses going forward. Does that help answer your question? Okay. Anybody want to add to that?
Well, I can't speak for how all the other teams are structured internally, but at CSRA, we have a centralized business development capture and proposal organization. So after every proposal that we do an independent lessons learned session, whether it's a successful bid or an unsuccessful bid. In fact, we like to request debriefs for programs that we've won, because if we're winning, we want to be able to repeat those things. So, we have these internal lessons learned processes, and then where applicable, and they can apply across the broader proposal team, we share and disseminate them. We have internal quarterly sessions where we go over the results of lessons learned, and then it gets cycled back down into our CMS account team. But we take it very seriously.
Yep, I just wanted to second that. I think a lot of companies take that information. That's critical for us. And we do have processes where we analyze the feedback. We'll categorize it. Usually debriefings revolve around price or staff qualifications, or maybe an element of the approach was perceived as too risky. And some of those things are things we will incorporate into our organization, and if we're consistently high on price, we need to figure out why. Sometimes if the reason we didn't win was because the approach may have been perceived as a little risky, sometimes we're okay with that. Sometimes we feel like that's still where we want to be, and maybe we need to communicate that better. But to answer your question, that information is critical. It is tracked. It is followed. We use that as data. We have regular meetings, and we look for patterns. And if there's patterns, we start to take corrective action in our company and figure out ways to respond.
Just to reiterate, ours is exactly the same, which I think is why we're so appreciative and anxious to get that feedback, because there are such control processes to make sure that it's digested, and then we improve our processes accordingly.
Okay. Yes.
Okay. One thing we've seen in the government, and I can just speak for my area, and I want to applaud Melissa, Derek, and Ed Hughes for kind of working on the briefing aspect and how we think about it. But one thing that happens pretty consistently amongst contracting officers is they try to have a good open debriefing, and they get the P word, the protest. And are you going to, was that one of your questions? I guess it's really debriefing, but you really weren't talking about protest at all, right, Patty? Okay. So, one thing I see is that contracting officers, over their history and experience, they try to be open with a contractor and they get a protest. And what tends to happen, it tends to just shut them down for forever. So I just think from a contractor standpoint, I would kind of like to hear, and I'm not sure, just raise your hand, how many of your companies have filed protests before? Have filed protests?
Oh, I think we just did.
Not with you guys, but with states.
Not at CMS. No.
What's that? No? Have you, Phil?
Yeah, with states, not with you guys.
Oh, okay. So just the thought is, like, how do debriefings impact whether you do or don't file a protest? Because at least in my experience on the government side, the more we tell you, the more we're at risk for a protest. And that's how we perceive it, and I just see it over and over and over again. So from talking to industry, when we do get protests, it does impact how the contracting officer reacts to industry, going forward. So I'd just like a little bit of input back on that.
I'll start. In a protest, in a debrief, there's never the intent to say, let me hear what you say so I can figure out how to protest. You're really looking to understand how why you won or lost in particular. And I think I've gone into every one, I'll speak for myself, with the assumption, with the belief that there was legitimacy to the loss and seeking to understand and do better next time. So that's never the intent. It would only be if during and this is an extremely, I think, unusual situation, if during the meeting the information provided was clearly inconsistent with the loss, which would be a pretty unusual situation, I think. So I would encourage, I think the more you understand why you lost, the better it is. I mean, you can have a solution that wasn't the ideal solution. You can have a team that was more senior than was expected. There's all sorts of reasons why a proposed approach wasn't selected to be ultimately the best choice. So I would just say I think it's more helpful to be able to go back and in great detail just explain what wasn't viewed as the best alternative. And I think that pretty much, from a industry standpoint, I think clearly shuts down the process. You've debriefed, you improve your process, you move on. So I can't speak for everyone, but I would assume it's very similar.
Well, yeah, and I would say when we receive a debrief, particularly on a loss, it's kind of a two-step process. We look at it and we say, is there something in the debrief that is inconsistent in the proposal, which could be potentially grounds for protest? But then secondly, we're really just trying to improve, and I can't speak for all the other vendors, but we have a lot of work at CMS, and we know the impact that throwing a protest would have on you, and, we understand we're not going to win everything. It's part of the business. But there's a fine line I think CMS has to walk in your debriefing letters, because if you don't provide us enough information, it's almost like a challenge that you have to protest to get the information. So I understand it's a fine line you have to walk. And I would say one potential way that we may be able as vendors to avoid the potential protests is say, once the protest period is over, if CMS would be willing to sit down and have an in-depth debrief with us where, they know there's no threat of protest because we really are just trying to get better.
And I'd say from our years of experience doing trainings and engaging with acquisition professionals, I don't know how many times we've come across that question, and we've said that government shouldn't automatically think that a protest is a failure on their part for some reason. There's lots of reasons in industry why people protest. It could be an arcane acquisition policy issue. They just decided because of something that this is the perfect way to test the courts. It could be a lot of different things. And so size, scope, and complexity, there's a lot of different reasons. But I think that the key that I've heard many acquisition professionals is say, if you do get protested, can you win it? Can you defend your actions? Can you document it throughout the acquisition process and make sure that you made a sound, reasonable business decision when you do that, and that your documentation does, in fact, line up and you can defend it?
Yeah, I guess I would say I've worked for 3 contractors since I left government, and none of them were very enthusiastic about ever submitting a protest. Every single one has been extremely protest averse. I would encourage CMS and the contracts office to not worry too much about that in the debriefing content. I think the level of detail there is really helpful. There probably are a few contractors who are a little bit in a knee-jerk protest position. There are folks like that in our business, unfortunately. But I think those companies are probably going to protest no matter what you put in the debrief. So I don't think, I really would hate to see concern over protest damage the level of information being shared. I have not seen that in my experience working for contractors that, we approach it that way. It's always about just trying to do a better job, and very, very rarely does anyone think that that's the correct course of action. I know you guys get a lot of protests, but I don't think it's related to the level of information exchange in the debrief process.
Go ahead. Let me just add to, while Brian's getting the mic, is that I know that sometimes debriefs comes out and they just focus on the weaknesses and not necessarily the strengths. I believe, and I would think that most contractors would say that knowing what the strengths were of our proposal is as valuable as the weaknesses. So I know that sometimes, just to kind of get it done and be able to, to get it finished, or whatever the case may be, or because it's on the schedule and it's not really required, that we do just see why we lost and not necessarily what might have been really strong pieces of our proposal. So I would add that, if it's possible, that's really an important part for us, is to know what, not only what did we not have that we needed to, but what did we have that was really strong, and we would want to keep using that over.
And I won't. Oh.
Yes. Yep. Thanks. So, hi, I'm Adam Forgione, Contracting Officer here at CMS. And just to change topics real quick, When we are putting together a milestone schedule, I know very well how long it takes to do all the different processes here within CMS, and we try to give industry as long as we can, given our time constraints, to make an award to respond to those RFPs and RFQs. But it's really, I've never been on your side of the fence, so I don't know exactly what it takes and what happens, when I hit submit and put the RFP out there, what happens from your perspective. And I know it's a broad question, but can you talk about, what it takes to reply to these things and how long you would like?
Well, I guess maybe I'll start being kind of from a broad view. I think it depends on certainly the size of the opportunity and the size of the company. If it's large, medium, small, on the amount of people involved. But I think, as I was saying earlier, there's an acquisition process at industry that parallels the government process. And so there are often gate reviews where different company functions, depending on, again, how big the company is, you'll have legal and pricing and capture and the solutions. Perhaps in the medical field, clinical folks and solution folks, they'll be there along with company leadership to decide, okay, what is this opportunity? Is it really there? Are we well positioned for it? Who are our competitors, et cetera, along the way? And they'll be, just as you have milestone decision events in the government, same thing, and those gate reviews happen in many companies and industry. And so there's a lot of times a justification for more company resources to decide, are we actually going to continue to spend people's time and potentially assign other, if you have a centralized capture organization, tee up those people to plan and say, okay, they're saying it comes out at next March. Okay, what other opportunities between DOD and NIH and CMS and VA, all these other opportunities, how are we going to align our resources to be best positioned to have people, if we actually win it, to be able to staff that work, but then also to go after the proposal. And I think it'd be interesting to see what the rest of the panelists say on how they particularly do it.
Yeah, I'll just echo what he said. The sooner we can get out in front of these opportunities, the better for us. So I think Phil was saying, we try to capture opportunities a year, 18 months, 2 years in advance, because exactly as Brad said, we are competing internally for resources that are going to be dedicated to a DOD bid or a Department of Energy bid. So the sooner we can line up, your procurement timeline with our capture timeline, the better it works out. So the sooner we can get out in front of it, the sooner we can do things like start our technical review solution, because we have lots of gates that we have to go through internally. And if we've got certain criteria that if we haven't met, we'll kill the proposal effort. So it makes it hard for us when we see something that comes out, it wasn't announced anywhere, and it's due in 3 weeks or a month. They signal to us that these things are wired often, so we typically won't compete, and CMS may end up not getting any bids or one bid. So the farther in advance you can let us know, the better of a proposed technical response that you're going to get from us.
Just to speak to a somewhat different environment, I think the speed can also depend on the nature of the procurement and also what type of process CMS might be open to setting up. I remember I had experience working in an environment where under an IDIQ contract we needed to submit about 200 proposals a year to cover the scope of work. There were only, that's about every business day you're submitting a proposal. We could turn a proposal as fast as 5 days if parts of the proposal process were pre-established and the actual component of the proposal that had to be new for that particular event was narrowed down as much as possible. So, where it's appropriate, and it's not always, but where, parts of the scope of services could be pre-established, templates can be used, things can be pre-agreed, so that where there's a need for a specific new component, it can be narrowed to the greatest extent possible. So I think every environment adapts to what the critical characteristic is of that environment. If speed is the desire, then increasing the standardization of the process can accelerate the process greatly. So.
Any other comments related to that? Yes. Right here. Oh.
Hi, I'm okay. So I wanted to add to this that it also depends on the requirements in that RFP that comes out. So if you have requirements for key personnel and a list of 20 people that you need to provide, really is a big factor into this. And if you're giving the contractors 2 weeks to respond, that's really hurting, both parties. So I would say some smaller organizations, and I've been on both ends of the spectrum, have more agility in terms of, let's get everyone together and then put a response, all hands on deck. But they don't have the bandwidth to cover a lot of proposals at the same time, versus the large organizations where they have the process, that they need to go through, approvals, they need to take into considerations the risks, but it really comes down to those requirements. And what I want to suggest to CMS and other organizations, draft RFPs are very valuable to us because it allows us to prepare from a technical solution to really looking for the right people that would be necessary for that project execution. And then RFI responses, kind of a, I would say, statement of objectives usually are very helpful, and due diligence sessions. So those are really valuable to the industry.
Thank you. Go ahead. I'm Nathan Barbado. I'm a contracting officer in OAGM. When we submit our solicitations, we have evaluation criteria, and we're hoping to get good discriminators for the best solution to our requirements. Do you have any comments or challenges responding to the evaluation criteria?
So we've done some of these different sessions for other agencies, and I've heard just about in every session when that topic of evaluation criteria comes up, everyone says, when I first get a solicitation, the first thing I look at is the evaluation criteria. And then I go through and look at C, L, and M and make sure that you cover those bases, because those are the most important things that really factors into that no bid decision and getting resources deployed ready to go. So the evaluation criteria is essential to that bid no bid decision on industry's point.
Yeah, I would agree, and especially if it's a recompete, we look at things, what we would consider, warning signs for us. If, for example, it's a recompete of an existing system and your number one evaluation criteria is corporate experience with similar type systems, that signals to us that you just want to give it back to the incumbent, so we're not going to typically pursue those types of things. And so I think this is a great forum, especially for the folks who haven't been on the industry side, to get to hear, what we interpret. It's a different language we're speaking, but it's kind of the same. So if I see key personnel as number one requirement or corporate experience with a similar technology, that's a stay away for us. But we really do, to Bradley's point, we look heavily at the evaluation criteria to say, should we invest in this or not?
Yeah, I would say on eval criteria, first of all, I think CMS does a good job with it. I think it is something that we all go to very early to kind of figure out what the government's looking for. I think some of the questions that come up a lot are maybe we have a good amount covered and maybe we need to find a partner for some aspects of the eval criteria, and then we're kind of wondering, is it okay to have a sub cover this one? And sometimes CMS addresses that, sometimes not. Sometimes that's a question. Or even if it's okay, is it still kind of like frowned upon, or is it kind of the same as the prime? So covering some of those elements with prime sub relationships is something that comes up a lot. The other thing I'd say is definitely don't shy away from being very specific in the eval criteria. We like that. There's no need to be a little squishy so everyone feels included. I mean, if it's something that's absolutely needed and we don't have it, we won't bid, and that's okay. And I think it's a good thing for the government to kind of use that as a screening process to some degree. So we like our eval criteria to be very specific, and some of those questions you typically get, address them, right up front so we can all make, quick, efficient decisions.
Okay. Just to add on, not only are the evaluation criteria very helpful, but any information that can be provided that helps industry sort of dial their solution to the desired outcome. For example, if if infrastructure resources are a limiting constraint, understanding that the solution being sought is the most effective without there being high new infrastructure costs, or conversely, if processing speed is most important, just highlighting that. Anything that helps us, understand what you're looking for and just understanding those dials, I think, from my perspective, when I respond, I find that the hardest to read between the lines and say, I know it says this, but there's a spectrum of options that could be provided, and where is the best answer to tune that solution to meet the right part of the spectrum. So.
And to add on one other thing about evaluation criteria, especially as it comes to some of the discussion recently around existing vendors and traditional vendors versus non-traditional vendors, if you're looking for innovation and you want innovation, but it's not in the evaluation criteria, you're not going to get innovation because industry sees that as a risk, and it's not. If you're not being evaluated against it, why put it in there? So it's very critical that if you're talking about innovation, you want innovation. Obviously, innovation is often in the eye of the beholder. Is it technology? Is it a process, et cetera? But being very clear, if you want something new and you're looking for that, make sure that that's in the evaluation criteria.
Yeah, and I think an analogy that we've used in the past, Leah, is if you've been driving a Ford, don't try to give them a Lexus because they want a Ford, and you can get in trouble by trying to propose something more if it's not in there to be evaluated again. So, anything else on? Yes.
Hi, I'm Gina Romano. I'm a contracting officer here at CMS. Just along a similar vein, I see at CMS, from my perspective, a lot of statements of work. And I've worked at agencies where they use a performance work statement. And I wondered if you had any feedback on when you see a statement of work versus a performance work statement when you propose to a solicitation. Thank you.
Did you hear that?
Yeah. I think overwhelmingly I've seen a statement of work, so I don't know that I have a lot of perspective that differs on that. So it's been my experience across multiple agencies.
Yeah, I think we're more accustomed to seeing statements of work here at CMS, so much more accustomed to responding to those. The PWS is something that's used more in other agencies that we respond to, but it's interesting because it allows us to understand what the acceptable quality levels are for each different specific area, so it does provide some value. I think from a response perspective, it's a little harder, more intense for us to do all the mapping. But you shouldn't worry about that. But on our side, when we see PWS, oh great, here we go. We got to map all this stuff out. But one thing that I look at when I see statements of work that has been a challenge recently, I look at the statement of work and I see 250 requirements, and I look at Section L and I've got 30 pages to respond. In those scenarios, it's so easy for CMS to come back and say, oh, you didn't respond to requirement 1.4 sub.III. So, I would challenge CMS when they're putting out statements of work to look at the number of requirements and the page count and see, if you can streamline it in any way. But thanks.
Anybody else?
Well, I think on the PWS or SOW issue, what I look at the very first assessment of that document is, does it look like the government is actually buying a service or product and they've got kind of a goal in mind, or does this read a lot more like almost like an operations manual for the current activity, and it requires 12 people with 5 years experience, and so we're kind of, whether you call it a PWS or SAL, we're kind of assessing it from is this all about kind of getting something that might be a little bit new, if we're not the incumbent. Or is this really about, kind of maintaining a very strong low-risk operation? So that's kind of our first glance at that document, and that's the best place to kind of get that feel. And I know that, there's sensitivities and pressures around how the government constructs those documents, but I think that's something that you should really look at in terms of how you develop those requirements. And the more it does look like, you have to keep delivering this report that not a lot of people know about versus we want this, end goal to happen, that really changes the way contractors approach business and pursue these opportunities.
Anita?
Can you all speak to, at the end of the fiscal year, CMS did some procurements that shocked a lot of the vendor community. with statement of objectives, requesting a white paper, then doing a down select. Can you all speak both large and small to doing those types of procurements? What you liked, what you didn't like, how could it be improved?
So the question's about stage procurements? Is that, the question was about stage procurements?
Yes.
Okay.
Yes. Normally, CMS is telling you how they want something done, and now they're giving you what they want the outcomes to be, and how do you propose, since you're the industry experts, how, and it's a change on how typically these procurements are coming out?
I'd say generally from our members, they like that. They like the statement of objective. They like the phase procurement approach and the stage procurements because, again, as I was saying before about the gates along the industry's acquisition lifecycle too, it gives you a time to say, okay, look, I'm likely not going to win if there's some kind of advisory down select where you bring the pool down to a smaller group of people or advise, do some kind of advisory information to them saying, look, based on what you've provided so far, you're not likely to win, then that gives them an opportunity to say, okay, no, I'm not going to continue to invest further and go off and do other things that they perhaps could win. So just to plug one of the things that we submitted to CMS is that we put together earlier this year a white paper, and that's one of the things that we recommended to them is to consider doing more of those types of activities where you have some kind of a stage procurement with feedback to industry, whether or not you're doing some kind of a demo or a demonstration or a problem-solving thing in person that the source selection committee then can evaluate and see, okay, based on the people that you've deployed, is this actually going to be a good team that actually thinks through these things in a way that you want them to once they actually get to the job?
Yeah, I think the phased procurements is an interesting idea. I know it's been coupled with a lot of agile development techniques, and CMS has done maybe, I don't know, 3, 4, or 5 of those in the last year. I think to some degree, maybe the jury is a little bit still out on that. I would really like to see the kinds of results that CMS gets, and I would hope that some of that would be kind of refactored back into that process. But I like the idea, I like the approach, I like the innovative thinking around that. But I guess I would want to see maybe CMS slow that down a little bit just to see how these go, now that you've got a couple kind of out of the gate. And the other thing about phased procurements is, even a more extreme concept of just pass-fail criteria. I like seeing those. I haven't seen a lot of that, but it's almost like the first phase should be, should we even bid on this? Do we even qualify? And sometimes the government and the vendor community can figure that out before we even have to put a proposal together, even a 10-page brochure, and that would save everyone a lot of time and effort. So that might be a way to kind of weed out folks or narrow the competition for the government very, very quickly, even without necessarily a first 1, 2, 3 month phase. You can just do that right off the bat if you can structure the pass-fail criteria. I have no problem seeing that. I'm sure I don't speak for the entire vendor community, but I actually like the clarity there.
I'm going to chime in. I love that. I've done a couple of those. From our perspective, we often cannot do, as you had requested, the very, very specific evaluation criteria, because as our documentation, of course, we're the government, it moves forward into multiple channels, then we get slapped on the hand for limiting competition. So we're between a rock and a hard place. We would like on the tail end, when it comes to evaluate, to be able to go, go, no go. It's the front end aspect that we kind of get nailed on. So, but my question was a little bit different in terms of all the things that we're hearing about. It all really stems back to the requirement, and how we define our requirement tells you what we're looking for and how to propose it back to us, whether it's 50 pages or 30 pages. How can you help us to develop and come up with some samples and examples of what are good ways to develop a statement of work, recognizing the crunches that we face in the government? We would love to give you 18 months. By the time we get our money, we got 3 months, ready, set, go. So how can you help us and educate us on giving us good examples and samples of a statement of work, a statement of objectives, so that we can go back to our program people and share that as well? The more you can help us, we can help you.
Anybody want
No, I'd say that's great. I think, getting back to what we said before about draft RFPs and the RFI process, if you put those out and have the time to see who are some of the people who put the time and effort in providing some good feedback to those, have some one-on-one meetings with those people who really came back and hit it back off the park and had some really interesting things that you really maybe not have thought of before, and then it can help shape the future of the acquisition there. I think too, I understand the issue of speed to acquisition, and one of the things we've seen in another civilian agency is that especially in technology, and in this particular instance, cyber procurement, they knew that technology is changing very fast, and so they set up a procurement innovation lab where they put together a cadre of folks who were in broadcast industry that, look, this is a unique place where we're going to try some things. It's going to be kind of our sandbox to do some things. And they were able to take, from the time they formed an integrated team with their procurement folks, their program team, their general counsel, the IT, CIO community, they were able to form a team and get to an award in 87 days. And that put a lot of stress and woke a lot of people up in industry saying, wow, okay, they're serious about this. And so some people liked it, some people didn't. But it was a very interesting experiment on how to use the FAR in a different, unique way through lining all the ducks on the government side fast, signaling to industry, hey, this is something that's going to move quickly, and deploying a solution and getting it aboard.
Hi, I'm Carolyn Robinson. I wanted to go back to the comment that was made about technical evaluation factors. And we move a lot of procurements a year, especially on the IT side. I want to caution folks not to read too heavily into evaluation factors. When we have, for example, technical capability as a first criteria, I mean, they're usually in descending, obviously, order of importance. Some are equal, some are not. That does not mean we aren't interested or don't want or want an incumbent or not want an incumbent. Really, when we're putting statements of work out there and we're moving a lot of dollars and we have a lot of procurements a year, we absolutely want competition. So something of similar size and scope, you see that in source of SALT, you see that in RFPs. It's really important for folks to know we're very serious. To the point that was made over here, it takes us a long time to get something camera ready. So when we hit the street, we start way before you all see it to hit the street. We absolutely want competition. We absolutely want innovation. And we absolutely want new ideas. So CMMI, key personnel don't necessarily mean the people working on it, but we need people who are proficient in what it is we're procuring. Technical capabilities, corporate experience, whatever vehicle we're using. So I do want to caution folks a little bit on that, because when we do procurements, it's a lot of work for you, It's also a lot of work for the government. And we absolutely want competition. So I want that to be known.
Thank you.
Hi, my name's Deborah Stidham. I work in the Office of Acquisition and Grants Management. I have two questions. The first, kind of piggybacking on you, Patty, you indicated the value of hearing about your strengths in debriefings. Do you also see value in hearing about your strengths during discussions, which is above the minimum requirements of providing your significant weaknesses and deficiencies? The second question is, I'd like to hear your opinion on the value of oral presentations in competitive procurements, and especially if you have varying preferences in terms of the methodologies used and also the impact on industry.
Well, to answer your first question about the strengths, absolutely. I think, again, it's as important to know whether things that we did well, were they really things that we did well? What stood out? Because just as much as we look at, I think all contractors kind of do their own assessment of their proposal. We have our reviews, the pinks, the reds, the greens, the golds, and we're looking at, where are the strengths, where are the weaknesses as well. So I think anything we can learn and pass on and just, and disseminate throughout with our proposal team is going to be of value. So I would, any of that is of value to us. On the second question, does anybody want to take a shot at that first?
Can you repeat the question?
The first question or the second?
No, the second one.
The second question, just kind of getting your perception or your perspective on oral presentations and competitive
Sorry,
procurements.
I have a very strong opinion.
The impact, the value, and also, I guess, perspective on the various methodologies.
Oral presentations are extremely helpful to industry. We try and write to be as clear as possible, but words are always subject to interpretation, and the oral presentation really as an opportunity to be clear and to have, to have any questions come up. Also, a great opportunity for CMS to see the individuals who would be supporting them and get a sense of the depth of their experience. So I think it's valuable both ways. With regard to methodologies, I would just say that a combination of formal and informal discussions during the oral presentation are particularly helpful. If there are questions that CMS has in advance, knowing those is helpful, but also having the opportunity for it to be an open dialogue. Because I think that's a great way to clear up any misconceptions for us, to address if we were unclear and can fix that, or if there's something that we didn't understand. So that would be my recommendation whenever possible to have those.
Yeah, I think on orals, I think most of us in the vendor community like orals. It's an opportunity to interact directly, with the client, obviously. I think the only thing I would say about orals, and to some degree this extends even to approach to statements of work, all of this, this all comes down to the vendor community kind of promising the government something. We could do this, we could do that. And anything can sound great, in an oral presentation or on a PowerPoint deck or in a proposal. And I think really trying to restrict things to proven solutions and why those proven solutions are applicable to the problem I'm trying to solve. And that can be the focus of the orals, and that can be the focus of the statement of work. But to me, that's really what separates successful contractors from ones that sometimes aren't as successful, is have you really done this before or something similar, and does it really translate to what we're trying to do on the government side? In some ways, the government has a huge advantage over the private sector because folks are out there experimenting, trying new things, succeeding, not succeeding, and you can kind of sit back and let that happen and then figure out those things that have really worked and then translate them to the problem you're trying to solve. So I like seeing eval processes, whether it's orals or written, really focused around proven solutions and why those are applicable to your particular mission or problem.
Yeah, and addressing, I think, the second part of your question, what's the impact to us in the vendor community for orals? So I agree with my colleagues that orals are very helpful for us, but they're very labor intensive, right? You might have 6 or 7 key personnel and you're doing orals prep every day, so they're expensive. And I've had the benefit of supporting some small businesses over the last year, and it's really harder, I think, on the small businesses to do orals because they're pulling people off that are working day-to-day delivering. They don't have the capacity that some of the largest do. But I definitely think it provides CMS with an opportunity to kind of get to know the people that you're going to be working with. So they're very valuable.
But and let me speak to that small business piece that JR said. I still think, even though you're right, it is hard on small businesses to do orals. I do think there's a lot of value, though, a lot of value for small businesses, because I think sometimes when you're looking at a small business to give for a procurement, you're thinking, okay, how small are they? Do they really have the people? And I don't think you can ever lose by having face-to-face contact, putting names to faces, and being able to, to actually see the expression and hear the plan and the solution. So yes, it is very hard because you do have lots of people that you tie up, and it does take a lot of resources. So I guess in saying that, I would want to hope that in those situations where you would use the oral evaluation, that you really would narrow it to those people who truly are going to have an opportunity to win, because because I'm going to invest a lot into that, and I would want to know that, that I have a good chance, or at least a fair chance, of being able to win.
Great feedback. Thank you, guys.
One thing I just would add, because I see we're kind of getting the hook here, is that we've talked a lot about the pre-award process. I know that to many in government is the mysterious part, because once you have post-award, they're in your working through your hallways and you see them more, and so that's less mysterious. But I would just say that that post-award communication is still key, like it is in pre-award, making sure that especially the government speaks with one voice to the contractor once they win. You've got the contracting officer, the COR, personnel security type work, especially if you're in the IT trying to get people cleared and badged on projects, that can greatly impact the success of a contract. And so communication is key through all of that. And want to point that out.
I don't think he's going to.
Okay. This has been very good. I think a lot of good information is being shared. We actually are past our 2 o'clock time. However, I'm going to let it run a little bit over because I don't think we have anything else in this room behind me. Can you validate that for me? Would you like to see this go a little bit longer? Okay. So we do have another session behind this, and that one is for.
It's the same thing. It's the Marston and I don't. Did anybody have the calendar?
If you have not had an opportunity
give
to
her.
go to the cost accounting session and you wanted to, that begins at 2:15 and runs to C1.
Okay, did you hear that? Cost accounting. I know that's important to a lot of people. So if you would like to stay another 15 minutes or so for this particular session, I'll let it run over for another 15 minutes. If you want to do the cost accounting session, that's next door. C112, thank you. So those of you who want to stay for another 15 minutes, you have it. If not, I would ask if you're going to leave, can you move out quietly and quickly, please? Okay, Patty, I'm going to turn this back over to you. If you're going to leave, please move out quietly and quickly. I'm going to give you another 15 minutes.
Okay, great. Thank you. Any other questions from anyone in the audience? Okay. The next question that I was going to ask the panel to talk a little bit about, and it kind of ties nicely with something that Melissa spoke about this morning, and that is, what are your ideas on the agile approach to competition? We'll start with Joan. You want to start?
Okay, sure. From an agile procurement perspective, I think it's helpful when the procurement focuses heavily on the process. The agile procurement process is more about outcomes and a little bit less about the specific requirements and all the details being defined right up front. So I think it's important that there's mutual agreement on how that process is going to be executed together. What are the gates? What are the time frames? Who's going to be involved? And how are disagreements or disputes going to be handled? So I think having a slightly different focus for agile, ultimate outcome and the process for getting there can be very helpful in the procurement process. And in orals and throughout the process, really vetting that the industry partners are familiar with that type of procurement, that type of delivery, and that there's mutual agreement about how that will be done together. So
that's talking about the agile development process. I think this was alluding more to an agile approach to competition, which is, I think, more on the flexibility of the procurement process, the ability to ask more questions, taking that sort of that same theory and applying it, though, to the acquisition process.
I was speaking more about procuring for agile, but I think agile procurement, I think we talked earlier about, the stages and those being extremely helpful to have that process be adaptable and defined. In that scenario, I think equally important, it's important to understand what are the gates going to be and the decision points and the decision criteria at each point. So I think the more that we understand that, the better we can respond to that and be successful. Okay.
So I think there's a lot of misconceptions or differing definitions of what agile is, right? And there's different levels of maturity as you talk about agile. But for, I think, agile procurements to work really well, or flexible procurements, it's about communication. the ability for CMS to quickly and multiple times respond to contractor questions improves the process significantly for us as contractors. The staged approach, I think, is, to Phil's point, the jury may be out, but I think in concept, it's better for us as contractors because we can do an agile, quick 10-page paper and find out, are we on the mark before we invest potentially hundreds of thousands of dollars in a bid. So.
Yeah, no, I'd say when it comes to agile procurement, I'm putting my former Hill staffer hat on here. I say just make sure that when you are doing agile procurement, that when you have different phases like that, I know that sometimes the overseers and the oversights from the GAO to OIG can be very hard on procurement folks so they don't actually document everything. And so making sure that you have that, that documentation there. But also, getting back to what JR was saying, when you're doing agile procurement, those questions, that communication being so key, making sure that you actually, if you get a question, you're not just saying yes or no or see document section 4, that this is a chance for you to elaborate more on what you're truly asking for. Just like when, I'm not a doctor, so I don't want to take this too far, but if you go to see the doctor and you say your back hurts, you don't want to just answer a bunch of yes/no questions, and you want to say, describe the pain. What was it? What were you doing when the pain happened? How long has it been there? I mean, different things like that. They want you to open up and talk about what your problems are, so that the industry can best come to address it.
And I think, in general, flexibility, is a good thing, and I agree with the comments. I think a lot around, the communication is really critical if you're going to, operate a contracting model in a more agile manner. I think it's not a bad idea to, if CMS is considering a little bit of a different approach, bounce that idea off industry, even just the mechanism. Say, hey, we're thinking about doing a more agile procurement. It's going to look like this. What are your thoughts? I think you get some really good feedback and some really good interaction that would help both the government and the contractor community.
Okay. Does anybody have any question about that? Okay. Do you guys have any other comments or questions that you would like to offer at this point?
I wanted to make one point. I think a good amount of the feds went to the cost accounting thing, but from being on both the government and the contractor side, it's amazing how much can go behind one requirement or two sentences in a statement of work. And I remember writing SALs when I was a Fed, and I would think, well, it'd be great to get this quality report monthly, and maybe we should have these 15 items. I spent 5 minutes writing that requirement. I had no idea what I unleashed upon the contractor community. They probably all went and hired a quality person just to do this, and how much value is really in that report. And so I think just being sensitive to, what's perceived as kind of a small requirement from the federal side might be adding a lot of burden, overhead, potentially. Some of that stuff is absolutely critical and must be there. But trying to wear both hats and think about, what does this look like in practice? Am I inflating the cost of my program by putting some unnecessary requirements in there? Sometimes contracts will have a very long list of deliverables. Some of them overlap to some degree, and a lot of the Q&As around things like that. But that's the one thing that I really noticed is kind of the heightened level of sensitivity around burden and making sure you're only doing things that drive value and help accomplish the project.
Okay, well, we'll take that as your final comment.
Yeah.
Brad, do you want to make a final comment?
So we talked a lot about pre-award. I did have some thoughts on post-award as well, and I think that I mentioned some of them about making sure that the government and industry are speaking and communicating together, especially government with industry of one voice. I've heard of other examples, not necessarily in CMS, where there's a question about who's directing the contractor to say things, and then oftentimes the scope may change, and then it's the relationships perhaps between the program side and the contracting side are not connected, and oftentimes it could be the contractor saying, hey, you really should talk to the program person because they're saying I need to do things that are not in the contract. So making sure that regardless of what happens, that you're communicating with one voice, and that if we're unhappy for some reason with the government or the contractor's performance, is to make sure you tell them right away so they can address it. It's the old, if you're unhappy with performance, tell the vendor. If you're not, then if you are though happy, then to tell others and share that success with other people.
Great, thank you. JR?
So I know CMS is moving a lot more towards agile, DevOps type procurements, and from an industry perspective, we're excited about that. We really encourage it, and I would request or challenge CMS to look at the nature of how you've structured some of your legacy contracts as impossible impediments to getting what you want for DevOps or Agile. So for example, you know, if you're asking for a DevOps approach to maintaining an existing system, but you have one database contractor, one infrastructure contractor, or requirements contractor, it makes it very hard to get what you want. So you might have to take a look at how you've structured your existing contracts as you move forward to implementing Agile and DevOps.
Just one other one thought with regard to the burden potentially as SSOWs and procurements are being shaped. I've seen some successful examples where there's a method for managing flexibility in the contract so that, you know, where things change, where decisions need to be made, there can be sort of a built-in mechanism for trade-offs, you know, whether that's a portion of the overall size of the contract or some other vehicle. And that, I think that really helps the management of the contract later when choices arise without really increasing the price. So wherever possible, I'm trying to have built-in vehicles for those, for that flexibility and trade-off.
Okay. Anybody else have anything else? And I would just like to make my final comments to say, first of all, thank you, CMS, for inviting us, industry, to give you feedback. Thank you for trying to constantly improve and to work more collaboratively with us. And we appreciate the ability to be able to communicate and the possibility of communicating better as we move forward. So if there are no other questions, we'll wrap it up.
Thank you very much. Thanks so much.